Absolutely.
Okay. So I don't know anything about
His kids were
it. So he knew nothing about the postcard. So what's the postcard? Creating
Mr. Chairman.
Mother, father and son. Union money.
Call to order the November 1st, 2021 St. Lawrence County Legislators Board meeting. I need a motion for suspension of the rules to allow the attendance of meetings telephonically or other similar devices made by Mr. Forsythe and seconded by Mr. Reagan. All in favor?
Aye.
Opposed? Carried. Kelly, do we have a roll call vote? A roll call.
Reagan,
Here.
Forsythe,
Here.
Lightfoot,
Here.
Sheridan,
Here.
Smithers,
Here.
Denisha,
Here.
Perkins,
Here.
Akers,
Here.
Bay,
Here.
Haggard,
Here.
Fiaco,
Here.
Burke,
Here.
Arquette,
Here.
Terminelli,
Here.
Curran.
Here.
15 present.
Thank you, Kelly. Legislator Denisha, would you lead us in prayer and follow by the pledge of allegiance?
Bow our heads, please. Dear Father in heaven, we thank you for the opportunity to gather here this evening. Please accept our continued gratitude for the numerous blessings you have bestowed upon us and our country. Dear Father, too often we find it easier to criticize the behavior of those we do not agree with, rather than looking for the good. Too often we belittle one another, simply because we have different points of view. Please grant us the ability to work with one another in singularity of purpose and cast aside our personal and political differences so that we may achieve solutions that are best and just for all. When our evening's work is complete, we ask that you guide each of us on our journey home. Grant us a safe return. For all these things, we ask your blessing through your Son and our Lord, Jesus Christ, in whose name all things are possible. Amen.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Just quite a program before we get on with the rest of the meeting. We have a longevity ceremony. We have some employees who are not here, but they have their 30-year employee certificate coming to them. For emergency services, we have Tammy LeBrake. The Highway Department, we have Scott Murray. Office of the Aging, we have Sherry McGill. Public Health, Terry Burnett. Real Property, James Race. The Sheriff's Office, Michael McHugh. Social Services, we have Susanna Law. Another Social Services employee, Ruth Ann Narrow. And also Social Services, Randy Stoffel. For the 35-year employee in the probation department, we have Renee Miller. And Sheriff Brooks Big Wharf, if you're here, if you'd like to present this next proclamation, you're welcome to do so.
So it's my honor to recognize Joyce Wood. She's sitting over here tonight for 40 years of service with the county. That's 4 decades for anybody that wants to do the math. For her hard work and accomplishments, and appreciate your dedication. Putting 40 years into numbers, perspective time-wise, that would be 480 months, 2,087 weeks, 14,610 days, 350,640 hours, and here's the kicker, 21,038,400 minutes of working for the county. That should put perspective on all this. Which leads me to the next question, why are you still working? Just saying. She's a great employee. She's had the chance to work under 4 sheriffs. Keith Knowlton was her first sheriff she worked under. Gary Jarvis, Kevin Wells, and myself. And it's an honor for us to work with her. And I'm sure she's seen many different jail administrators and staff come through in 40 years. But what a ride. To work 40 years in your career, you have to enjoy it, at least sometimes. Enjoy it. So I, as sheriff, for the last 2 years, I've been lucky to work with Joyce. Easy to work with, very enjoyable employee. She works with our records and does all of our benefits and all of our accounts. And I can tell you, she's above board and she's to the penny on everything she does. And she's a stickler with that. And thankfully she does, but she does an awesome job with all those things. Muhammad Ali once said, she knows I talk sports, we talk sports all the time. Quote, "It's just a job. Grass grows, birds fly, waves pound the sand. I beat people up." Thankfully, Joyce doesn't beat people up. She's the nicest person to people. She treats them with respect, and she has pride in what she does, and it shows every day. I couldn't ask for a more hardworking employee than Joyce. 40 years is one heck of an accomplishment, and you should be proud. I thank you. I won't read it because I can't see without my glasses on. And the pin for 4 years. I don't, is this the only 4-year pin?
One I know of.
And this is something else, the only 4-year pin we've ever seen in the county. So that's one awesome. That's why she's good, folks. Thank you very much.
We have a couple 10-year employees as well. Both of them have to be legislators. First one on the list, legislator from District 8, former chairman of the board of the Madrid area, legislator Kevin Akers. Will you come forward? I'll present you with your flag. And I'm sure you must have some words that you'd like to say as well. I know you. In recognition for excellence and outstanding service and appreciation of 10 years of dedicated service to St. Lawrence County, you have earned the respect and appreciation of your peers, as well as the gratitude of the county administration and the citizens of St. Lawrence County that you dutifully serve. And some congratulations, and there's a little pen here as well. And, you can put on your lapel. Okay. And there you are.
Thank you very much, though.
Hold it up. Thanks.
Upside down.
Thank you.
Okay. I'd like to say it's been a pleasure working with all of you, but you know that's not always the case, but we have been able to get along, and I respect everyone's opinion. I may not agree with you, but in the end, we're all working towards the best of the county. And people should know that. The people that vote for you, they must believe that. And it's not an easy job. And we get evaluated every day. It's not yearly. It's every day. Somebody will give you a call and let you know, right? Okay, thank you very much.
Thank you.
Next, we have legislator Tony Hardwood, District 13, who is on the screen here with us tonight in that top right-hand corner.
Hey, Tony.
And Tony has had his certificate and pen mailed to him at his home. And Tony, congratulations. I could read the same thing, but I don't have it in front of me. I have to get Kevin's to look at it. So if you'd like to read it, you can, or if you have any words of wisdom you'd like to share with us, we'd love to hear from you.
Thank you, Mr. Chairman. I think Kevin really said exactly what I would say. It's been an honor to serve the citizens of St. Lawrence County for over 10 years. It's an honor to work with everybody in that room right there. And I came that close to being able to make it there this evening, and I ran into a couple of obstacles. I look forward to attending in person real soon. congratulations, Joyce, and all of the other high seniority folks being recognized. Thank you for what you do every single day. Thanks.
Now we'll move on to approval of the agenda. I need a motion to approve the agenda by Mr. Lightfoot, second by Mr. Forsythe. Any discussion? All in favor?
Aye.
Opposed? Carried. Need a motion to approve the October 4th board minutes. Do we have a second or a motion by Mr. Denisha, seconded by Mr. Perkins? All in favor?
Aye.
Discussion? First discussion, no discussion? Favor? Opposed? Carried. Now, the COVID-19 update is next. Jolene, would you like to go first?
Sure.
Okay, Jolene, and then Dr. Williams will follow.
Get my. Okay. Okay. So, as of today, we have 12,662 cases. We have 32 current hospitalizations, 431 people active on isolation, and 12,100 have completed isolation. We have 131 cumulative deaths. Our daily hospitalizations, like I said, today we have 32. Sorry, dog in the background. We've got 32 today. We've been averaging for the last week in the high 20s for hospitalizations, which is trending in the opposite direction of where we would really like to be going. For our weekly cases, with 1 day left in our counting period for the week, we have 347 cases. So we are down a little bit from last week, but like I said, we still have that 1 day left. We are averaging for new daily cases per week with a 6-day average. We're at 57.83. Last week, we were at 60.86. And for the beginning, the first couple weeks of October, we were at 70 cases per day. So for our weekly school cases, for October, we averaged 96 cases per week, which is down from 108 in September. So it's when, the kids and teachers got back to school, we did have a lot of them testing positive. We are still a lot higher than where we would like to be. We're just a little bit higher than our highest spot where we were in January at the peak of the last school year. So for our weekly college cases, we have 14 so far for this week. We're averaging 14 to 20. So we're steadily staying low, which is a much better place. We're still having more than obviously what we would like, but we're doing better than we did at the beginning of September. So just a total of people that have been through our process. We have 431 people on active isolation. We have 1,201 in mandatory quarantine. And then we have 52,876 that have completed the process. And so just a comparison from October to September, our cases, we had a little bit fewer cases in October from September, but not many. So the majority of our cases continue to stay in that 0 to 44 range versus the 45 and older range, with our eldest population really not seeing too many cases there anymore. I mean, for percentage wise. For our hospitalizations, we had 94 hospitalizations this month. So we are seeing, like I said, more people being hospitalized. We did have 4 people ages 0 to 19 be hospitalized. So that is an increase. And that our majority of them for this month is a change from last month. It's at 75 to 84, but the second group being 45 to 54. For our transmission, we are still on high transmission. Our positivity rate is 5.26. For the total population fully vaccinated, that includes everybody from birth to our oldest resident, we're at 55%. So for the 12 plus population, that's the population that's eligible, we're at 63.2. The 18 plus population is at 64.2, and our 65 plus is at 83.8. So for our vaccine distribution, we are seeing a steady increase. Next month, I will be able to put the booster doses on it. We're still working on updating our spreadsheets, how we're tracking all of that. So during the month of November, we are doing every Monday from 8:30 to 2:30. We're offering Pfizer in the public health department. We are working on figuring out when we will be doing Johnson & Johnson clinics in-house. But for community booster clinics, this Thursday, we have at Augsburg Free Academy, we're doing boosters for Pfizer and J&J. Next Tuesday at the Messina Community Center, we're doing Pfizer and J&J. And then the following week, we will have one at the Governor Community Center, but we are still working with them to solidify a date. And just as a reminder, Dr. Williams will go into more details about booster eligibility, but it's been all vaccines have currently been approved for a booster, and they do allow now for your booster dose, not for a third dose, but for a booster dose to make it interchangeable. So regardless of what you got for your first dose, you can get any for the second dose as long as you're eligible based off from what you got for your first dose. If you need transportation, you can always call the Volunteer Transportation Center for a ride. And if you are on the homebound list, just give us a call. For the 5 to 11-year-olds, that's what we're all pretty excited that this is finally almost an option. The FDA has approved it. The CDC advisory board is meeting today and tomorrow. And then from there, the CDC will needs to do their final approval. New York State needs to do their final approval. Well, we have pre-booked 900 doses. Our ancillary supplies have already shipped. So we got approved for the full 900. It's just the vaccine itself has not shipped. So we have a tentative clinic scheduled for Saturday, November 14th from 9 to 4 p.m. We did send out a save the date on Friday, the 29th with a QR code that allows you to sign up to be notified when our links are available. So we are working with the local pediatricians in the county to be able to pull this event together. So we're going to be doing first doses at this clinic for anybody 5 to 11, and then we'll have a separate link for anybody 12 to 17 and 18 and older for their families. We really want it to be if you haven't gotten vaccinated, you're coming with your child, we want to vaccinate the whole family. We've been partnering with the colleges to make it more of a different type of event to try to get the kids' minds off from getting a shot. So the colleges are providing the mascots. The sheriff's department is working with us to provide some canine units. We'll have Sparky the dog. There'll be some firemen dressed in gear doing fire prevention. We might have a few other things that still working on that, but just something to keep the kids occupied while they're getting their vaccine. And then we're also working with New York State to either host clinics at each school or community clinics. It's going to depend on what we can get for New York for resources. We're also working with some of our pediatricians to potentially do some school clinics that way. But that's what we're going to be shifting gears towards the 5 to 11-year-olds, hopefully here next week. And then just to go into a little bit of information about our updated testing quarantine supplemental information that came out from the state last week. This is in regards to quarantining for K-12 schools. There are 3 different options that we're giving, and it is something where if we do and decide to do this, we have to ensure that all of the schools in the county participate and that we do it at a county level and not at a school level. So this is something that we are actively working with the schools, superintendents, and hospital systems to determine what's best. So the first option that the state put out that they do not recommend at this time and will not provide any resources or assistance is a test to stay. So this option is where every student on quarantine would have to be tested every morning before they could attend class. The school staff would have to perform the testing. It wouldn't be something that the local health department would come in and do the testing for. Every school would have to create a protocol to ensure equity. This ensures having a way to test students that do not have transportation, as they would not be allowed to ride the bus. We do have a limited supply of antigen cards, hopefully arriving tomorrow. We did order some through the state for the month of October. It hasn't come in yet. So we ordered in September, don't have it. So that is another barrier, is limited rapid testing supplies. So it's not something that we are actively going to be implementing at this time. For the second option was COVID testing to permit return to school after symptoms. So we are allowing antigen tests now for people who are fully vaccinated or have had a COVID-19 infection within the last 90 days to return to school. Anybody that's not fully vaccinated or not a previous positive cannot use an antigen test to return to school. They still need the PCR. However, with the tests that we are getting in, if an individual were to, say, develop a headache or runny nose while at school, they could go down to the nurse's office, get the antigen test, and then if it comes back negative in 15 minutes, they could go back to class. So we are going to be implementing this, and that will prevent some kids from being sent home. The third option is the test out of quarantine. New York State also does not recommend this at this time and will not provide any technical assistance or resources for counties that do put this into place. This option should be used only when diagnostic testing resources are sufficient and available. And I do believe that Dr. Williams will be going into some more testing as well. So essentially for this, it's you would have to have a PCR test after day 5 or after. It would have to be verified with the local health department in order to be let out early. And it would have to be, like I said, the PCR test. So one of the things that we hear all the time is we don't have access to testing. We're working on that. We do provide more tests in a 7-day time period than surrounding counties. But it's an option that we are also not implementing at this moment. And that is all I have. So I will turn it over to Dr. Williams.
Dr. Williams?
Good evening. So I was going to start with a brief overview of the national trends that we're seeing. And fortunately, we continue to have this nice downward turn in number of new cases on a national level. If you look at the trend summary, you also see that for cases, for hospitalizations and deaths, we continue to have a decrease again on a national level. One observation that I thought I would share is looking at what happens with the Delta surge in terms of the duration. So the Delta variant is the version of COVID that's been causing the most recent surge nationally, internationally, and locally. So if you look at other countries, if you look at France, Canada, and Israel, what you see is that they each have had a Delta surge, or like Canada, or toward the tail end of it. And for each of these surges, you're seeing that the surge lasts for somewhere between 90 and 110 days. If you look at what's happening in the US, in states like Florida or Texas, kind of a similar pattern, about 120 days, and then the surge seems to be over in those states. If you look at St. Lawrence County, we're about 90 days into our current surge. But what's important to realize is that if you look at the dates, Florida and Texas really started their Delta surge back in July, whereas for St. Lawrence County, we started in earnest at the beginning of August. So this is kind of a predictive thing, but it's conceivable that if we follow this pattern, we're 90 days into a 120-day surge. So maybe we'll have 30 more days of this. Again, it's going to be dependent on people's behavior, but I just wanted to put this out there as kind of a way to look at what's happening, again, internationally and throughout this country. The one kicker is if you look at a few places like the United Kingdom, they don't seem to be following this pattern, and they're still going strong at about 149 or 150 days into their Delta surge. I'm not sure why some countries are having that experience, and I'm certainly hoping that our county doesn't encounter that. I did want to give a brief update on outpatient therapies that are available. I feel like this is a topic people like to hear an update on. So right now, per the FDA, there's one approved outpatient therapy, and there are at least 3 promising options, and then there's a whole number of things that are under review. The NIH has a very nice COVID treatment guidelines site if people are interested in looking. As far as what's approved, so right now, monoclonal antibody therapy, and there's several different versions of this, are currently approved, and I'm going to talk more about them shortly. As far as what's promising, at the last presentation, we talked about Merck has a new antiviral medication called molnupiravir, and it showed a 50% reduction in hospitalization or death. It's not yet FDA approved, but it's going through the process. Inhaled budesonide, which is actually a common inhaled steroid that's used for people with asthma or COPD. There's a United Kingdom trial called the Principal trial that did show promise. It's not FDA approved for this indication, but it is one of the things that I would list as a promising outpatient therapy. And then more recently, the Together trial looked at something called fluvoxamine, which is actually an older medication that's used for things like depression. But they did show some pretty promising findings looking about 1,500 subjects showing there was a decreased rate of hospitalization. That's FDA approved for other indications, not for COVID. But again, I would just put that out there as things that we may be hearing more about from the FDA. As far as what's under review, so that means there's insufficient evidence to recommend it or to strongly recommend against it. We have things we've talked about before. Ivermectin is undergoing 2 large randomized controlled trials, one in the US and one in the United Kingdom. Colchicine, a common medication for gout, is also showing some promise. But mixed reviews, something called interferon and an antiviral called Avigent. That's just 4 things that are under review. There are many others. So that's the brief update on outpatient therapies. I did want to focus a little bit, though, on monoclonal antibody therapy. So, and specifically in St. Lawrence County. So, what is monoclonal antibody therapy? So the most common one that people are familiar with, and the one that we currently have in our hospitals is called Regeneron. And it's an antibody cocktail. So these are antibodies to COVID that can be administered intravenously to people who are sick with COVID. Reasonable question, does it help? There's a number of studies that look at it, but there's one that just came out in the New England Journal that showed like a 70% reduction in the risk of hospitalization or death in properly selected patients. It also shortens the duration of illness. So who can get this? So this is not for just everybody who gets COVID. It's for people who are 12 and older. You have to weigh a certain amount. It's for people who've got mild to moderate COVID-19 who are at risk for progression to severe illness. And there's a whole table of what we call risk factors. So looking at people who are more advanced age, who have comorbid medical illnesses, maybe they're immunosuppressed. So I think an important question is, how do people get this? And there's been some stuff in the press, which I think is real, about the fact that people are getting COVID. They're living with this as outpatients. They're having a hard time. They don't need to be hospitalized, but they're still having a tough time at home. And we're really making an effort with the local medical community to make this more available. So for the two major hospital systems, we have RNs who are calling patients who are positive, and they're doing like an initial introduction or screening to see if somebody might be eligible for this therapy. And then we're really encouraging people to contact their primary care provider who can actually order the therapy and make it happen as an outpatient. And then for people who are sick enough to be in the emergency room or urgent cares, that's another option. Now, the amount of this medication is restricted by the federal government and by New York State. So we get a certain allotment per week. Both hospital systems are ordering as much as possible, but I just want to, make sure, we've talked about this before, but I want to make sure people are aware that this is effective and available. Jolene talked about vaccination rates in St. Lawrence County. I thought I would just put out there that if you look at New York State, so this is for fully vaccinated. So for New York State, across the state for fully vaccinated, it's about 67, it is 67%. Where St. Lawrence County, we're at 55%. I think looking at the age demographic is really helpful to sort of understand where it is that we have the most room to improve. So if you look at on the left-hand side, this is for New York State. Each of these columns represents the percentage for a given age group. And on this side, it's for St. Lawrence County. And if you look at the younger age group, so between the 12 to 15 all the way through the 45 to 54, what you see is that for St. Lawrence County, for the 12 to 15, we're just 5% off. But for the 16 to 25, we're 17% off. For the 26 to 34, we're 20% off, then 17%, and then 13%. If you compare the people in the 55 to 75 plus, we're much more at par with the state. So again, this just sort of illustrates that our deficit in terms of vaccination tends to be with the younger age groups. As far as vaccine safety, there just keeps being more information coming out, supporting the safety of these vaccinations. We talked before about the difference between VAERS and the VSD reports. This was something that was just published on October 29th, looking at mortality risk in people who were vaccinated. It looked at 11 million people who received vaccines and who were carefully monitored, and showed that there was no increased risk of death associated with vaccines. It's something that's been put out by some people. And then if you look at the safety surveillance through the Vaccine Safety Data Link, again, it's continuously reporting with a high safety profile. If you look at vaccine effectiveness, the CDC has now started tracking hospitalizations based on vaccination status. So this is US data. If you look at the rate per 100,000 people who are unvaccinated who are hospitalized during the Delta surge, continues to increase. If you look at the rate of hospitalization for people who are vaccinated, it continues to remain low. For New York State data, similar trend. The blue line is unvaccinated. The red line is vaccinated. And then for cases, again, it's the same pattern. In this graphic, the black line represents vaccine effectiveness. More data is coming out on vaccination for adolescents. So this is not the 5 to 11, this is the 12 to 18. And a study that the CDC published showed there was a 93% reduction in hospitalizations for this age group. People who were hospitalized, it was 97% unvaccinated, 3% vaccinated, and none of the people who were vaccinated ended up in the ICU. Again, as Jolene showed, there's not a large number of people in this age group who are hospitalized, but certainly on a state level or a national level, it is a considerable number. And then finally, despite Delta, again, the infection rate, hospitalization rate, and the death rate is dramatically higher for people who choose to be unvaccinated. As far as the 5 to 11-year-old vaccine update, so the FDA Advisory Committee met and they voted 17-0 to recommend that the Pfizer vaccine be offered to those ages 5 to 11. There was one person who abstained. The things that they considered are, number one, Pfizer presented a clinical trial where they showed that the vaccine seemed to be effective and also seemed to be safe for this age group. The FDA folks pointed out that about 1.9 million children in this age group had been infected, and it represents about 9% of all the US cases. More than 8,000 children at this age have been hospitalized, and this is national data, right? So across the country, 94 kids this age have died. If you look at the total pediatric deaths, it's now around 700. And this thing with long COVID, so people who have persistent symptoms after the resolution of their acute infection, is well documented. I would say how common it is still up for debate. The FDA for this age group was saying that it was around 9%. And then, as Jolene alluded to, with talk about quarantine and isolation, certainly COVID and everything having to do with COVID is very disruptive to school. And then from a public health perspective, even though the kids typically don't become very ill, they do end up unfortunately transmitting the infection to family members and to other people in the community who are vulnerable and likely to have a worse outcome. And finally, they noted that COVID is now a top 10 cause of death in this population. If you're interested in reading more about this, the American Academy of Pediatrics, I thought had a nice little easy to read piece talking about the risks and benefits that were considered by the FDA panel. And next steps, so the ACIP is going to review this, then the CDC director reviews it and hopefully approves it. New York State has its own advisory task force that will review it. And then finally, New York State Department of Health will provide guidance that will allow the Department of Health, pharmacies, and physicians to get this in the community. Booster vaccinations. So as far as the scientific rationale for this, what's been very clearly demonstrated is that COVID-19 vaccination for adults, it remains effective. But what we found is that vaccination is less effective at preventing infection or mild illness or symptoms over a period of time. So after like 6 months with the mRNA vaccines, there's maybe some waning protection. Similarly with healthcare providers, they're seeing that over time, there may be an increased risk for people who are in high-risk occupations to become infected despite vaccination. And then because of Delta, plus the time that's elapsed, there seems to be a reason for boosters. So that was kind of the rationale that the CDC and the FDA looked at. So the current recommendations for Pfizer and Moderna is that if you receive those, you're eligible for a booster if you're 65 years or older, if you're age 18 or older and you live in a long-term care setting, if you're 18 and older and you have underlying medical conditions, or if you're 18 or older and live or work in a high-risk setting. The recommendation is to get a booster 6 months after your second shot. And this is for Pfizer and Moderna. And as Jolene said, for which booster to get, the vaccines, the 3 vaccines are now considered interchangeable. So if you receive Johnson & Johnson, you're eligible for a booster if you're 18 or older, and you're supposed to wait 2 months after your initial shot. And as far as which booster to get, again, mix and match has officially been approved by the FDA and the CDC. So you could receive any of the 3 vaccines interchangeably. And the pharmacies, your physicians, everyone is aware of this. I did want to quickly touch base on this issue with hospitalizations, both in our region and also in our county. So this graphic is actually for the North Country region. So that's the 7 counties in our region. And what you see when there was the Alpha surge and now Delta, for routine hospitalization, which is in the blue, we had more hospitalizations during Alpha at the peak, which was back in the end of January, beginning of February, compared to Delta. So the total number of hospitalizations was higher. But if you look at intensive care or critical care patients, what you see is that it's at least as high or higher now. In fact, it's higher now in our county, as I'll show, with Delta. And the ratio, so people, as we talked about with Delta, younger, sicker, quicker, people do seem to be much more ill. This graph looks at St. Lawrence County. It looks at hospitalizations, particularly this is about ICU hospitalizations. And what you see is back in our previous peak, our ICUs were full, but not overfilled. Now we're looking at, near peak capacity for our intensive care units. And this is a problem. And as far as what this means for the community, so we've got, 2 hospital systems in our county, which are very strained in terms of resources and staff. When we try and transfer patients to bigger medical centers, if they have a severe COVID illness or a non-severe COVID illness, this is really a challenge because it's not just our hospital that's filled up. Routine care and things like elective surgery are always potentially at risk of being delayed because the hospitals are so busy. And probably the most important thing is this means, these are we've got, I think at through both hospitals, we have like 8 or 9 people who are on life support right now. So these are our community members who are here with COVID, and it's unfortunate. So just to summarize, so national trends are encouraging. Unfortunately, in our county, we seem to be, I said mid-Delta surge, we're hopefully toward the end. And again, it seems like the Delta surge is about 120 days, at least in this country. We're on day 90. There is effective outpatient therapy with monoclonal antibody therapy. It is underutilized in St. Lawrence County. There are several promising outpatient treatment options, which will likely be approved soon. More and more data comes out showing that the vaccines are safe and that they're effective. And again, I talked about treatment tonight because it's important, but prevention is really the best medicine. And despite Delta, the vaccines do seem to decrease the risk of infection by 5 times, hospitalization, death by 10. We're 12% behind on vaccination rates compared to the rest of the state. And the gap is really in our younger residents. Boosters are now available for eligible individuals like we talked about. Pfizer is likely to be approved for the 5 to 11. And finally, it's just a reality that our local hospitals really are straining and struggling because of all these critically ill COVID patients. And this impacts the care of non-COVID patients as well. And I guess finally, I would just say, if you haven't been vaccinated and you're eligible, please consider a decision to do so. And that's it for me.
Thank you, Doctor. Any questions to Dr. Williams or Jolene? Yes, Mr. Terminelli, Legislator Terminelli, go ahead.
Thank you. Thank you both for your update. We all look forward to it. And Jolene, thank you for a very long phone conversation that we had this evening, in which you explained the whole test to stay and the new options to get out of quarantine that are really recommended right now. I appreciate that. When you show the chart of weekly school cases, those numbers are not necessarily contact or positive at school, right? It's not necessarily contracted at school. It's just staff and students that are positive. Is that correct?
That's correct. So any staff member, faculty, staff, student that is associated with a school gets counted as a school case.
Okay, but not necessarily spread in school.
Correct.
Okay, thank you.
Go ahead, Ms. Kern.
Yeah, in new business last week, I had asked sent out the report that I believe it's Cuba County puts out about how many cases it has, how many are active, and then the hospitalizations, what the age groups are, and then they kind of spell out how many people are vaccinated, how many people are not vaccinated. I don't know if you had thought any more about that, and then I have a part B question.
So Cayuga County does not report on a daily basis, which we do. They also are averaging about 20 cases per day versus our 60 cases per day. It's one of those things where we're actively working on trying to verify. We verify every hospitalized vaccination status within NICIS. And with the number of hospitalizations coming in, the number of cases coming in, our current workloads, we are having some staffing challenges. It's just a matter of, is it more of the priorities at this moment until I can get fully staffed?
I think that the
Rita,
people,
Dr. Williams?
oh, sorry, Dr. Williams.
Go ahead, Dr. Williams.
I just wanted to mention, and I'd be happy to talk afterwards. I think the other thing is people looking at the percentage of people who are vaccinated or unvaccinated who are hospitalized is not a terribly meaningful data point. And what most people represent is the percent of people who are hospitalized looking at the proportion of people who are vaccinated in the community or unvaccinated in the community. And so, for instance, if you have, even if you had 50% of people being hospitalized and they were over the age of 55 in this county, 30,000 people are vaccinated in this county in that age group. So if 5 of them are hospitalized compared to 5,000 people who are unvaccinated in that age group, it's actually showing that the vaccines are highly effective. It's kind of a long discussion, but I think making sure that you have the right proportion is important. And keeping in mind too, that in a small community like that, one of the hospitals right now, 100% of the people who are admitted are unvaccinated. So it varies from day to day. And again, that data point is not as meaningful as looking at the graphs of the hospitalized vaccinated compared to the greater proportion of the.
Can I go on to part B?
Go ahead.
So part B is the community reaching out to see how it's being reported in the community that they have actually a floor now in one of the nursing homes, someplace that has COVID patients. So the person that called me is asking, does that affect what goes on in the rest of the nursing homes where they are housed, or is it like a separate nursing home that just has COVID patients in it?
Rita, I didn't hear the first part of your question.
I had a constituent that called me and said, I understand that one of our local nursing homes has now a COVID floor of COVID positive patients that are in the nursing home, that are being treated there. I know for a long time we had nobody that was going back to a nursing home if they were still COVID positive. The concern from these people were, is this nursing home strictly COVID positive patients, or are we intermingling COVID positive patients with not COVID positive patients? And I don't know if you have any data on that, but I said I would ask.
Dr.
So
Williams? Go ahead, Joanne.
Well, the nursing homes have strict protocols that they have to follow once they identify a COVID positive patient. So they move the individuals to an isolation area, and depending on how many there are that are positive, depends on if it's a floor or a wing. But they don't put the quarantine individuals with the positive individuals. They might have a quarantine location and an isolation location, but they do keep them separate. So they might get moved around a little bit until their status has changed.
Thank you.
Mr. Burke.
Dr. Williams, you talked about the monoclonal antibodies, and but you also mentioned several other drugs, budesonide, fluvoxamine, and colchicine. Well, the colchicine, we know, like you said, is a gout drug. Are the other two under investigation, or are they currently being prescribed?
So if you look back at the slide, I had under promising therapy. So inhaled budesonide is something where there was a fairly large trial in the United Kingdom that showed some benefit. There are other ongoing trials, but none of those three things, none of the things other than Regeneron is actually FDA approved for this indication. So, and colchicine is one of the medicines that's also under investigation. There are some studies that are favorable. There's other studies that aren't favorable. So the science is still not conclusive on colchicine specifically. The drug from Merck, they published a clinical trial. They're now in the process of applying for their FDA authorization, but that's not happened yet.
Thank you.
Any further discussions? Any questions? Thank you very much, Dr. Williams. Jolene.
Thank you.
I'm going to go on to communications. Kelly, do you have any communications?
I do. A card was received from the family of former legislator Fred Morrill, thanking the Board of Legislators and department heads for the sympathy card, flowers, and donation to the Northern New York Junior Bassmasters. A card was received from Jacob Farley, club president of the Northern New York Junior Bassmasters, thanking the board for the donation made in memory of Fred Morrill. And I have 6 emails that I'll read in full. The first one is from Rachel Phillips from Helena, Montana. Even though I am voicing out from another state, I was born and raised in St. Lawrence County until 10 years ago. I was always grateful to have a county that protected our children when parents failed their roles. I have worked in school systems for 10 years now, and I personally know what it takes to be an advocate for these innocent children. This is why I'm writing on behalf of the child group. I have witnessed a situation that has disturbed me, and I can't seem to understand the reason behind these. I have witnessed a distant relative with numerous children, one being born with heroin in the baby's system. Yes, CPS stood up and took the children, but yet returned them to this relative short term. And I try to understand how children should be with their mother. 2 of the children were born with fetal alcohol syndrome, and all of that happened when this family was being monitored. But years later, this distant relative OD'd in front of her children, again, 8 weeks back in mother's custody. I cannot wrap my brain around this situation. Now to a more disturbing situation. My sister, who was in a verbally abusive relationship for years, is going through a devastating situation no mother would ever dream of going through. She was verbally abused, and language was used that no child should have to live every day, but yet CPS doesn't see anything wrong with verbal abuse. Now knowing just a piece of what my sister and her children have been through, and if you are any decent human being, you should realize the trauma this abuse could cause on anyone. My sister fled to my place of living 3 years ago with her children, and in fact would be that the children were always in safe hands. They were never in any danger. When my sister was hospitalized from a high-stress situation, her husband came. He said he was going to the hospital to make sure she was okay, but he took the kids while my sister was there, never stopped to see his wife, nor for his children to say goodbye. The most absurd part is when a CPS employee called me and asked if the children should be with their father, and I stated he was very verbally abusive. I can still hear the words to this day. She stated, "That won't change overnight." My mouth dropped. This is an employee who I thought should put her neck out for these children. These are the workers who are supposed to be protecting our children. I have been witnessing my niece and nephew struggle for years now. Again, anyone who has a heart would see children who can't see a parent who experience what my niece and nephew are experiencing, would say at least counseling. Yet no one from CPS is speaking for these children. My question is why? Why is no one checking in on these 2 precious souls? Why does CPS think it's okay for them to see their mother sometimes 6 hours a week, and that's if they're lucky? Why is CPS not doing their job? I do believe it is a corrupt system, and I thank God child is involved. It has been almost 3 years and not once, other than one phone call I got when the kid's father picked them up, has any CPS employee reached out to any of my family and asked our side of the story. If they had, they would have heard that the kids were never in danger. Like I said, I'm a mother myself, and I love those children like my own. They would never be degraded from myself. The first summer we visited, we asked to see the children and got turned away. I went to my nephew's baseball game without the father knowing, so I saw my niece and nephew for maybe an hour with my visit to New York and have not seen them since. My sister would always make a visit to us as we would to her every year, and that has not happened thanks to CPS. As I finish up this comment, I want to say I watch month after month legislators hear these victims' sides of the story, and not once has anyone spoke up for a solution or even just to show an emotion towards these victims. Where is the compassion for these children who are suffering? Not one soul has even blinked an eye. I just pray none of your family has to go through anything that my sister has and is experiencing. The next email is from Jordan Newcomb of San Antonio, Texas. My name is Jordan Marie Newcomb. I am 25-year-old addict in recovery as of June 2021, when I checked myself into Potsdam Canton Hospital in New York for withdrawal. Since then, I have completed a detox program before relocating to Texas to reconnect with my family and focus on my sobriety, far away from the people and places that enabled my drug abuse. During this time, I found out I was 5 months pregnant, which further prompted my commitment to staying clean. I have proven my dedication to starting a new life for me and my baby since moving to Texas by engaging in chemical dependency services through my doctor, who currently has prescribed me Suboxone. I have also signed myself into parenting classes, which I have completed and have a certificate of completion. I also have voluntarily participated in 3 random drug tests, which I passed. I have filed for benefits as well as health insurance for myself and my child. In July 2021, a New York State CPS worker had phoned my sister at her home, threatening her that I was never going to get sober, let alone stay sober, and that I was incapable of being anything except an addict. And if she did not kick me out of the house, she would have my sister's children taken away from her. When my sister refused, she proceeded to call Child Protective in Texas to have her investigated. The CPS found no proof of abuse or neglect and could not find any reason that my presence, so long as not left alone with the children, my care would be harmful to the nature of the children, and in fact deemed her home to be clean, healthy, and happy, and a great place to continue to stay during my recovery. On October 8, 2021, my daughter was born at Women's Emergency Center, University Hospital, a hospital in which we chose precisely due to their special treatment in high-risk pregnancy for women who have been prescribed anti-opioid medication in the care of infant withdrawal. After she was born, Texas CPS did a home inspection of the place. I lived with my sister, her husband, and her 2 children. We drafted a safety plan and concluded that it was safe and a loving environment in which my child could be raised when she was discharged to me from the hospital. During the inspection, my caseworker in Texas had divulged that she was highly concerned about the safety about my baby due to some recent information given to her by New York CPS, stating that I have extensive criminal history and drug charges, along with a completely fabricated story about how I was found nearly dead on an overdose, taken to the hospital prior to my move to Texas. Every part of these statements is false. I do not have criminal history, nor do I have drug charges against me, and I certainly did not get taken to the hospital for an overdose. These are all just out and out lies. When Tara asked for proof of these allegations, none were provided. The New York State Child Protective Service has since tried everything in their power to continue the onslaught of harassing, using more and more devious methods in order to derail my sobriety, including trying to obtain custody of my 1-week child who was born in Texas and move her to New York. This caught the suspicion of the CPS in Texas, who has since sought the advice with their legal team and superiors, feeling that this course of action was not only unusual, but encroached on the issues of legal jurisdiction. On October 21st, I unexpectedly served court documents 1 hour before the announcement of a court hearing that neither I nor my court-appointed attorney was made aware of. This created an unfair advantage, leaving us only 1 hour to prepare for an unexpected hearing. They ultimately brought my case before a judge in New York Family Court in order to discuss the jurisdiction of whether or not they have the right for the removal of the child when my care based on false fabricated information and slanderous judgments and discriminatory opinions about me as an addict, which were unsupported and unsubstantiated with any proof or investigations. The documents in which I served stated that they were looking to remove my daughter due to the neglect of my week-old daughter, who they claim was born with illegal substance in her system, which kept her hospitalized due to the withdrawal of these illegal drugs. I have documents from the hospital that states my toxicology report came back negative for any illegal substance other than my prescribed medication. Knowing that this information was incorrect, they still proceeded with the hearing, knowing full well that the information was wrong. I feel that this was done deliberately in order to create a biased opinion against me that could be substantial enough to bring on a court order that favored my child's removal from my custody. Later that night, I called the hospital to check on my baby when I was told by the staff that I was no longer allowed contact with my child. I immediately called my caseworker, who informed me that New York had contacted her stating that they had a new order in place for no unsupervised contact between me and my daughter. This was against the advice of her doctor, as I was breastfeeding at the time and my child needed my milk as part of her recovery. I had told my caseworker that I had no knowledge of this new information as it is not presented to me in court. She then began to question this and called New York CPS asking to see the documents supporting the new order, but she never received them. On October 25th, after not seeing my daughter for 4 days, my caseworker called the hospital and revoked the no contact order due to lack of proper documentation. I'm writing to you today in hopes that you can do something to help me stop this constant onslaught of discriminatory harassment and psychological abuse that the state of New York, via their Department of Social Services, has consistently forced upon me and my family, using any and all power they have before them by block my intentions that they may have to remove my child from Texas and move her to foster care in New York. I'm more than willing to fight for my child, but I cannot fight for her in New York, as I'm afraid I will be dragged back into the life that I have fought so hard to escape. I'm happy to share any and all proof and documentation that supports this statement in hopes that you will find it to be true and unfiltered. I pray that you find it within you to help me, as I am absolutely desperate and completely unmatched in competing against the overwhelming power of an entire state who refuse to believe that a victim of their own opioid crisis could ever be anything more than an addict. I moved to Texas to prove them wrong. The next one, I'm writing you as a citizen of St. Lawrence County, resident of the Village of Canton, regarding a resolution that was previously listed on the Operations Committee agenda and was tabled to be considered at the Services Committee meeting on November 8th. More specifically, the resolution is entitled Establishing a Foster Care Resource Policy Regarding the Future Placement of Children into Foster Care Owned and Operated by Employees of the Department of Social Services. First and foremost, I follow all Service Committee, Operation Committee, Finance Committee, and full board meetings each month. It is my understanding that since members of the public began attending and expressing various frustrations with the Department of Social Services, the board's ongoing stance has been that the board cannot take a stance in defense of the Department of Social Services until a full investigation has occurred. However, this resolution seems to be taking a stance for no other reason other than to appease these members of the public, despite a full investigation not yet being completed. What other reasons would there be to support this resolution? As the resolution itself states, permanency plans developed by the department are reviewed by family court every 6 months. There is a scarcity of foster homes available to the youth of this county. In the practice, the department employees being certified foster parents for these children is not against the law. The resolution goes on to further state that the members of the public have expressed concerns with the practice. Members of the public have also expressed concerns with members of this very board and have in fact called for their resignations. Yet we don't see a resolution addressing that concern being brought forward. It is a well-known fact that there is a shortage of available foster homes, not only in St. Lawrence County, but throughout New York State in its entirety. As this resolution states, there are approximately 10 youth in foster homes of a department employee. That's 10 youth out of over 300 children in the county in foster care, 3% to be exact. This resolution also does not speak to whether or not any of these 10 youths are kinship placements, which are required under various statutes and legislations. That would be interesting to know as well. Furthermore, the Family First Prevent Services Act is now in effect, has been discussed at various meetings before this board. As you may or may not be aware, if a foster home is not available for any youth and conjugate care is utilized, a qualified individual, QI, must complete an assessment and make a formal recommendation for what level of care that youth should be placed at. For example, if a youth is placed in a conjugate care despite a formal recommendation to be placed in foster home, simply because no foster home is available, the St. Lawrence County Department of Social Services will lose all IVE reimbursement for the duration of that placement. Perhaps when the cost to the taxpayers of this county continues to rise, maybe then members of the board will listen to the staff of the Department of Social Services and work collectively to address the issues. Should you be interested in learning more about various requirements, costs associated with Family First Prevention Services Act, you can do so here at newyork.gov. It has also come to my attention that there is a petition circulating that supports this resolution being passed. According to a recent article in North Country Now, Communities Helping Individuals Living in Distress, CHILD, proposes what they call solutions. To that I state, many in support of this resolution being passed state that employees can foster children from other counties. However, that defeats the obligation DSS employees have to keep children in their home communities to minimize the trauma they experience, being able to see their friends, attend their same school, and continue in sports, etc. Many in support of this resolution being passed state that if a child is freed for adoption and/or are older children that may be at risk of aging out of the system can then be placed in foster homes of a DSS employee. So long as another county oversees that case, we are DSS employees cannot simply have cases handled by another county because of a select group of individuals in the public think they should. This suggestion also speaks volumes to the great need we already have for more foster homes, considering they find themselves referenced older children aging out of the system, let alone the greater need that will exist if this resolution is passed. Children should not be granted a chance to have a forever home simply because they're close to aging out of the system. And there has not been a foster home available to them where the adults don't work for the Department of Social Services. Even more egregious, CHILD insinuates that if a Child Protective Services report were to come in on a DSS employee, that employee may be friends with the assigned caseworker and therefore may receive special privileges. All reports that come in on another Child Protective Services caseworkers are handled by a neighboring county's Department of Social Services. And if the employee is not a caseworker, there are protocols in place to prevent a friend from handling their case regardless of where they work. Additionally, New York State utilizes an online record-keeping system known as Connections that further protects subjects of Child Protective Services reports by marking their case as sensitive if the subject is an employee and/or if the subject is akin to the employee. Once a case has been marked as sensitive in the Connections database, any access to the case is severely limited to only those directly handling the case. Attached to this letter, you will also find a petition opposing this resolution's passing, containing numerous signatures and comments to such as well. I sincerely hope you will help us to help protect the children and family of this county by adamantly opposing this resolution. Thank you for your time and attention to this matter. Dear legislators of St. Lawrence County, I would like to share my opinion and complaints with you today, but in a way that may bring some attention to the seriousness of the matter and the reasons why you are being addressed. I can easily start with my repetitive complaints about St. Lawrence County DSS, but I would rather start with resolutions. You are elected and paid to fix the major issues that have already been expressed to you in St. Lawrence County. In any profession, workload size and lack of training are the major cause of failure. Losing sight of the object is the first to suffer. In this instant, the safety and well-being of the children should always be first and the only objective. This goes from immediate need to long-term and substantial physical and mental well-being. By not addressing the immediate problem at hand, you are creating a vicious cycle of long-term abuse, neglect, and mental health issues among these children, and you are creating a continuous cycle as they will never know any difference. The importance of sustaining true family bonds will never be if you do not correct how DSS is currently performing. Statistically speaking, this neglect and abuse becomes a generational issue if the agency cannot properly maintain and facilitate healthy relationships with the individuals who need assistance and resources, which should be readily made available to them. A child in need of an immediate emergency removal due to abuse or neglect must be placed in a safe environment without any prejudice. Placing children in foster care should not be an adequate job security or job perk for St. Lawrence County DSS employees. The amount of children being placed in foster care in St. Lawrence County compared to the rest of the state should be a major red flag to us, as it indicates that there is problem assisting the individuals who need help the most. Proper reporting to ensure that the appropriate criminal charges for abusive patterns should be a priority as well. No one should be allowed to abuse a child and not have any consequences. Likewise, no one should have to suffer for the consequence of being falsely labeled as abusive due to insufficiencies at DSS. Each case that comes through DSS should not be left to the discretion of the caseworker. Otherwise, how can you ensure the safety of the child when this is allowed to happen? I have firsthand experience with this. When a maltreated child comes into the child welfare system, that child's mental health needs should be addressed immediately. This is just not occurring in St. Lawrence County. Our system is designed to fall into the hands of the court, too often with the stipulation and conditions that do not benefit the child whatsoever. An example of this is demonstrated by how few legal advocates this county currently has employed at the moment. You should all be asking, how are these caseloads being managed, and how often do they actually have the opportunity to see the child on an individual basis? This is relevant because these are often the only people tasked with advocating for the child, and often, depending on the child's age, they may not even have met the child. These are children, not numbers or dollar signs. This issue is the same when it comes to the DSS caseworkers. Some of the caseworkers that I have worked with in my granddaughter's case have never observed, spoken to, or met with her. This is an issue. This is a DSS issue, but you are all responsible for this, just like any parent is supposed to be. In my granddaughter's case, I have attended family court many times, and as a result, I have seen firsthand how the system operates with the social workers, the child law advocates, and judges, and in my personal opinion, it's a complete joke. The constant back and forth between the parties to come up with a quick settlement to avoid a trial is honestly the most dangerous outcome for a child. The lies and inappropriateness that spew from the mouths of these supposed to be professionals is outrageous. And for what? To make their day easier because they are so overloaded? This is not advocacy. This is not helping these children, and in fact, it is often contrary to the child's best interest. I will never be able to understand how a case, for example, a preventative case, can use up so much time and effort just to come to an abrupt end in court with no regard to a child's safety. None of this makes any sense. Family unity, regardless of the case, should be a priority. I completely understand that this means supervised or permanent placement, but the child has to have the opportunity there. This is never a priority of DSS. They do not utilize the resources, training, or time to facilitate such an important task for children and the parents in the system. The long-term results do not benefit any child. The agency must always have a plan in place to address the needs of the child and the parent to sustain safety. I highly suggest that St. Lawrence County implement a diversion program to relieve some of the family court overload of cases that do not need to be on the docket. This will free up social workers' time, child law advocate time, and resolve many issues that would free up the court for proper child cases that need to be in front of the judge. A complete revision of the foster care application process must be looked into to ensure safety. An agency employee should never be considered for foster placement, as this is a huge conflict and an utter stain on ethics. I would personally love to see a full-time community visit facility that is fully staffed with professional trained employees and may help with the difficulties associated with supervised visits. This is a change that would benefit family unity, thus it would be a benefit to the system as a whole. I know that I am suggesting some things that may not be feasible at the moment, but I ask you to at least look into them. You are at a critical point where you can choose to sit back and do nothing or be part of a solution by taking responsibility and making improvements to the child's safety, rather than fighting with the families and organizations trying to help to make a difference in the lives of St. Lawrence County children. My personal experience have been filled with nothing but disappointments and failures on the part of the agency at the expense of the children. The Department of Social Services has completely failed my granddaughter and her siblings. My family has suffered so much emotional abuse that I can't even bring myself to repeat it all. The children have suffered physical, emotional, and mental abuse at the hands of their biological mother, but nobody stepped in to help. A judge from Franklin County ordered for two of the children to have agency supervised visitation only and transferred it to St. Lawrence County, but this was never facilitated properly by St. Lawrence County. This was another utter failure by St. Lawrence County DSS, as they literally left a third child in the home with no regards for the judge's orders or any concern for the well-being of the third child. Regardless of the neglect and abuse situation, the children would still have benefited greatly from agency supervised visits, but the need of families and children are of no concern to some of the caseworkers. I can personally attest that my family was spoken to in a manner that was inappropriate and unprofessional, that often included foul language. I personally felt like the children were not a priority at all, as their needs often went unmet by DSS caseworkers. As DSS caseworkers were bending over backwards to accommodate the mother, the alleged abuser. How can St. Lawrence County DSS continue to get these cases so incredibly wrong when Franklin County DSS indicated this woman on a CPS report? This detail was ignored by St. Lawrence County. When I questioned why this was, I was told that St. Lawrence County DSS caseworker that they did not believe Franklin County, and it was up to St. Lawrence County DSS to handle the outcome, so they didn't have to do anything if they didn't want to. This kind of behavior is seriously dangerous and the reason children get hurt. It has also come to my attention that St. Lawrence County DSS employees may possibly be using resources to veto and object to complaints, which is just another example of the big problem. Instead of using these complaints as constructive criticism for the purpose of improvements, they continue to fight a battle that helps no one, no child or family. I, like many other families involved, would like to formally request that Claudia Fantone, the Director of Child, be appointed my advocate in any investigative conduct by this county, this legislative body, or the Bonadeo group. As the grandmother of a child who has fallen through the cracks of a failing system, I feel that child is a benefit to St. Lawrence County, and I'm making this request as I trust their intentions, professionalism, and advice. I plead with you to consider this statement with the utmost seriousness, as I and my family are at the point now that we have nothing to lose by voicing our concerns. In total, we have spent approximately $40,000 in legal fees to protect a child, only to have my granddaughter, who has not been able to see her siblings in over a year. Protecting my granddaughter from the long-term psychological effect of this trauma is my top priority, and I will always fight for what is right for her. Thank you, Christine Cassidy. Two more.
That's it?
No, I have two more.
Okay, thank you.
My name is Claudia Fantone, and I was a foster parent in St. Lawrence County for 8 years. During that time, I have almost 50 children pass through my doors, but I want to tell you about my latest placement, a sibling group of 5 beautiful children. When they arrived at our home in August of 2016, there were 4 of them, as the youngest had not been born. Their ages were 5, 4, 3, and 1.5. A 5th sibling was born in April of 2017 and placed with us 3 days later. These children kept us busy every minute of our time, and honestly, in the beginning, I wasn't sure whether we were able to handle what we had taken on. The children were all very delayed and had many diagnoses and needs, but with time, it all came together and we became a family. These children lived with us for almost 4 years, and I had planned to adopt them all, if and when the time came. During our time together, which was most of their lives, as the three youngest spent more time with us than any other caregiver. We came to share their memories, good, bad, trying, stressful, and in the end, heartbreaking. A pain like no one should have ever had to endure, especially 5 small children. You see, it seemed we advocated too strongly for these children to get the medical and mental health treatment that they, especially one child, so desperately needed. St. Lawrence County DSS did not like that. The more we advocated for the children, the more our partnership with the caseworker deteriorated, and the more honest I was in family court, the harder it became to work with DSS. For example, after disagreeing with DSS in a permanency hearing, I was reprimanded for acting inappropriately, honestly answering the judge's question, and was made to sign a partnership development plan promising I would communicate better with DSS, example, go along with their version of the events. And I was made to attend a meeting with 8 members of their team while the children were involuntarily placed on respite. Another permanency hearing, another disagreement with DSS, and an immediate hotline call. This began the start of our nightmare. However, I did not let that deter us from advocating for the children's needs. And as a result, we began experiencing the retaliation that other foster parents had warned us of. This retaliation came in the form of threats, lies, and hotline calls from our caseworker. Why? Because we disagreed with the false narrative of the DSS caseworker, who in 4 years never stepped foot in my home or put eyes on the children. In the end, our family paid a heartbreaking price when St. Lawrence County DSS made the decision to move these 5 little children from a family who loved them like their own. This decision came immediately after we went over their heads to get one of the children the psychiatric help he desperately needed. As soon as we received this devastating news, which strategically and disgustingly came the day before we were scheduled to leave the country on vacation, we immediately started the process of appealing this decision and retained an attorney to fight to have these 5 children returned to us. Unfortunately, because of the COVID virus, it was a painfully slow process because the courts were closed for months. It took 1 full year to start our hearing. During this hearing, we had a caseworker admit under oath to destroy evidence in our case, perjure themselves without hesitation, and walk out of cross-examination stating that they didn't have to sit there and take this because they were not getting paid enough to do so, and they could not possibly do their jobs correctly given the work they were assigned. Now 20 months and $30,000 in legal fees later, as a result of DSS attempting to stall this process at every juncture, we have had our fair hearing in which DSS eventually conceded. Since our move from our home, we have found out that the children were separated into 3 homes. The 2 oldest have been moved a total of 20 plus times, including in and out of psychiatric facilities and institutions. It's ironic to think that an agency tasked with protecting children could so recklessly uproot 5 children from their secure, safe, and loving home of 4 years and move and separate them from their family and each other while causing them irreversible trauma and distress. Since their move, a 6th sibling was born and placed with the youngest 3 in a mobile home of a family who has 7 children of their own. To me, a retired mother who has never had as much as a parking ticket, this is all very wrong. Foster parents are the people who take these children into their homes. We love them like they are our own. We care for them. And then we have to deal with the agency retaliation and the unbearable pain of having these children ripped from our homes and hearts. Not for reunification purposes, because I could understand that, but DSS is disrupting the placement of children for arbitrary reasons. Some of these families do not even get to say goodbye. DSS just takes the children from school like there are no bonds between a foster parent and a child. DSS does not respect the foster parents enough to let them say goodbye to these children and does not even consider the pain and devastation this places on the child. Do they even care that they are destroying these children? The St. Lawrence County DSS employees responsible for this disgusting abuse of power were named in my previously submitted complaint. I have heard these agencies say the system is broken, and yes, it is, but they are the people who can fix the brokenness and stop the pain that they are causing these children every time they rip them from people who love them. We have all seen the articles in the paper from these agencies urgently calling people to come forward and certify as foster parents due to the increased need in St. Lawrence County. But Is it any wonder that they can't find and keep foster parents? Perhaps if they treated us, especially the veteran foster parents, better, there would not be a shortage. These victims are not numbers, they are not dollars. We are talking about the lives of innocent children who have been through enough pain. And the last one is from Cedric Somerville. My name is Cedric Somerville, and I'm writing this because my daughter Triana Somerville was found dead in the home of her mother in St. Lawrence County. I'm writing this because DSS and CPS failed my daughter. The system failed to get my daughter out of a house where it was crystal clear that she was being abused. The part of this that is disturbing to me is that CPS visited the house numerous times and nothing was done. St. Lawrence County CPS has failed my daughter and so many other children with no explanation on why this is happening over and over and over, even after my daughter's death. I want answers, and something needs to be done, and this broken system needs to be held accountable. I demand answers.
Thank you, Kelly.
You're welcome.
Next part of the agenda is to do with the citizen participation. Any citizen wanting to address the board is asked to stand at the microphone before giving their talk, state their name. Citizen participation will be in the form of an oral address directed to the Board of Legislators, members of the board. This part of the agenda is not a time for audio, visual, PowerPoint presentations, or performances. The address will be limited to 5 minutes. And I have a list of names here that I will call, and we follow those rules, and it will be okay. William Room.
Good evening, distinguished men and women. I'll get right to the point. It's the resolution. For me, it's permanency plans and hearings. They're the meat and the potatoes of the whole operation. I'm on the outside looking in. I have no firsthand knowledge of CPS intervention or lack thereof. These 175 victims here, they have the stories. One concern is the 3 times the removal rate and the foster child designation, according to the resolution, is at 15 months after only 2 court hearings. I ask that any current cases, permanency plans be put on hold or a deadline for the foster child designation, and permanency designation be extended until changes are made to prevent further mistakes in the CPS. I would also like to see the court monitoring change to 90 days instead of 6 months. This will allow more diligence by the courts regarding the implementation of permanency plans. I saw there was a petition by CPS workers fighting to remain foster parents. The information in the audit should show foster children who are funneled from friends and family, and these families earn salaries on top of that. Just an opinion, if you have, like one person does in your group, if someone has more than 10 foster care children, they are more than compensated for their job, and they should stay at home and not work at acquiring more foster children. I was a little alarmed, Mr. Burke, that Daniel Burke is an administrative assistant.
Excuse me. I want to tell you right now, I want to have you keep other people's names out of this other than the members of the board. And public school officials are part of that. I let you go with that last time, but probably shouldn't have. So try to keep it out of personalities, please.
Well, this is related to the PSS.
People's names out of here.
How much time do I have left?
Well, you've just taken up some of your time, so try to keep it not personal.
All right, well, there's an administrative assistant at DSS. She's directly connected to an Ogdensburg police officer, and kids are being pumped there. I support the resolution preventing future placement. However, CPS workers now housing children in their position should be terminated also. CPS mindset seems to be to remove children and place them in court custody under court supervision. Permanency plans are put in place, but big but CPS workers disappear for 15 months after the child is designated foster child, then they reappear as parents. CPS workers say their hands are tied. Maybe if CPS didn't assume the job of law enforcement, I fail to see where services apply to CPS, what services are currently working and what services are currently offered. CPS workers are reluctant because the goal is to keep families together. This allows children like Triana to slip through the cracks. I still believe it's a legal responsibility of this board to call a public hearing into Triana's death. My question, without knowing the failures, without knowing the failures, how can you fix this problem? There's a lot of information in the death of Triana that needs to be brought to light. There are human interactions that need investigation, and reluctance to set up permanency plans has consequences. Insurance permanency plans are in place and followed is essential. This is essential. It gives families an opportunity to keep the children and relatives, if not mom and dad. The function of CPS workers should be the oversight of these permanency plans rather than investigating people to terminate their parental rights. I'm told in other counties, permanency plans are multiple pages. I'm told here they're minimal. I would ask that this resolution be tabled and amended so that you can adjust to this. Just a couple things in closing. At a school recently, 2, 4, and 5-year-olds demonstrated knowledge of sex on a school bus that they would only know through observation. The district intervened. Administrators in schools cannot cherry pick who they refer to, and CPS should not involve school administrators in the decision-making process. Lastly, Ms. Haggard, you are not duly elected. Your husband is not dead. He is connected to this DSS debacle. You resigned as a judge, and you should resign from this legislature.
Mary Skelly.
Mary Skelly from Augsburg, New York. So listening to you read those letters, it's heartbreaking. What is the solution? I would say a constitutional sheriff could help us. I've reached out to Sheriff Baylor. I've reached out to members of this body, Ruth, Ms. Doyle. Some of my information has been leaked out. Just the stipulation you put on citizens coming here has been leaked out to the community. In my most recent tragedy, 2 people, myself and my beloved, precious child, we walked out of state custody on October 13th. OCFS was not done abusing us. They made another big error. Huge, despite being told no by law enforcement. 2 law enforcement agencies, the Division of Parole and the Augsburg Police Department. They went ahead and did it anyways. So now, who's coming to the rescue? The Department of Social Services is in my life. This ought to be fun. I will investigate their every single move. Every I better be dotted and every T better be crossed. Government retaliation in my family, federal. Federal crimes were committed against my family. State. Now here I'm in the local government. What's next? I mean, last week someone wished death upon me. One of our constituents, Mr. Lightfoot in Augsburg, called me a whack job today. This weekend, Ms. Garland, you had reached out to a party. They called on me about some postcard to see if I could look into it. And I'm sorry about the name that they called you, but that's really minor compared to what's the retaliation I've received. So I did my best by you, Ms. Garland. I chalked it up to this postcard as some union war, okay? If I could only go back to the military where they're making sure my skirt falls at my knee, those would be the good days of my life, not today. So I did a little investigation. You're welcome. I say it's union. not the party you reached out to, for whatever reason, I don't know. And why would I be called upon? I have got so much on my plate. Government retaliation, corruption, lies. On the side of the road, DSS wanted me to sign a stack of legal documents, quick, because they needed to get home to their family. Guess what? Not without an attorney, not without review. So in this rush, they get in a car accident with my child. Sheriff Bigworth, they come and serve me. And oh, by the way, your daughter's been in an accident. We don't have any details. Welcome home. Manageable healing does not occur with the government involved. I'm going to tell you that much. I want the government out of my life. I want to move on, and I want to heal. I will not comply to anything CPS puts on me, ever. It's my constitutional right. We do not document lies, send them up to a judge under oath, and then a judge quickly signs off on lies. Want to go further with that poem that they came in here last week? Can you tell when a CPS agent is going to lie against you? I can. Can you tell when every single interaction you have with them is going to be manipulated into lies? I can. Could I predict that they were going to get in a car accident with my child because that they were in a rush? Well, no, but maybe. Because the whole system's out of control. This is my child that I fought so hard to get home. Tooth and nail every day, blood, sweat, tears. Evil is powerless. If the good are unafraid, I'm fearless. I will not comply with CPS ever. They are the most destructive agency below OCFS, below child trafficking. They are child traffickers. Next month, we have an election tomorrow, a very important election. Some of you will just vote party line. Just vote party line for that family court judge, knowing the amount of abuse that citizens have endured by Alexander Lessig, me being one of them, targeted my child. Disgrace.
Lisa Newcomb.
Hi, I'm Lisa Newcomb from Canton, New York. I am a foster parent and a DSS worker. I am here to talk about the vote that the child wants to come about. The resolution calls for an action stating that St. Lawrence County employees can no longer be foster parents. It has been alleged that St. Lawrence County foster parents are making a profit from having foster children in their care. As a foster parent, I make under $20 a day for a child. This money is meant to be a reimbursement for costs associated with the care of the child or children that are placed in my home. This money is intended for me to feed them, purchase their personal care products, offset the cost of utilities they use, and cover any other added expense. That does not even begin to cover all necessities of a child in care. I urge you to do the math quickly in your head of what the actual costs are for one person each day in your home. Foster parents are taking children to medical appointments, mental health appointments, dental and optical appointments. This all requires the foster parent to take off from work using their own accrued benefit time, but also please consider the cost associated with the mileage, wear and tear on their vehicles, and if it is around mealtime, we have to feed that child. Yes, there is the option to have mileage reimbursed for medical appointments, but many caseworkers, DSS workers, foster parents, do not get most of it reimbursed. Many of us only ask for reimbursement for long trips. There's also many of our staff that have their foster children involved in activities such as sports or dance. These extra costs come out of the $20 per day. I'm aware that there are allegations that we are doing this for the money, but if that were true, we would all be licensed through Fostering Futures, where the daily board rate is much higher than that a DSS foster home gets. Our payment is governed through Office of Children and Family Services and is set much lower than what is paid to Fostering Futures homes. And I'm not trying to put Fostering Futures foster homes down. That's not what I'm trying to do. The staff that are foster parents that are licensed through DSS have been through the same training as any other foster parent. As DSS employees, we also have other training that we attend that enhance our ability to care for these children. As a DSS employee and foster parent, we set our own standards high because we are watched by the public, and we want to offer these children nothing but the best. We are all confused as to how anyone feels that we are making money out of fostering children. If you do the math, it is clear that much of the money for what these children need comes out of our own pockets without reimbursement. We have foster parents that have gone in the middle of the night to get children. We sit with these children in the hospital while they wait for treatment. We even sit up at night when they are crying, and yet we still come to work the next day. We want what is best for these children, and we are there working to reunite the children with the parents, just like any other foster parent. It has been alleged that we are taking children that are on our own caseloads, which we don't. We do not even take children that are in our own unit. We have staff that don't even work in children's services, but work for DSS. So they are even further removed from these than most cases. It was mentioned that we could stay foster parents and just take children from other counties. How does that help the children in our communities, and how is that what is best for the children that will have to travel all the way up to us from another county? We already have to send children to other counties because we don't have enough foster homes. So if thinking that closing 6 foster homes is good for the county, you're mistaken, and this will cost the taxpayers a great deal of money. We need more foster homes, not less. We need foster parents that are willing to take the hard-to-place children. We need foster parents that work with the birth families. As a foster parent, I still have contact with some of the children and their parents that I have had in my home. Those are the situations we strive for. The foster parent that everyone is complaining about that has adopted children, that can't go home, has biological children, has taken kin-gap placement of a troubled teen. They have a great family support system, and it works for these children. Despite the large number of people in their home, they have a ton of space. Their home is close to 7,000 square feet. They have more than enough food and still have these children involved in community activities such as sports. Employees of DSS that are foster parents could possibly have family members in their homes. That is why they become a foster home that is referred to as kin-gap. Some are even foster parents before they came to DSS. One I know of was once a foster and futures home, receiving a higher board rate, but switched over to DSS and is now, thank you very much.
Thank you. Courtney. Courtney Fantone.
Good evening. My name is Courtney Fantone. As many of you may know, I am the founder and director of Community Helping Individuals Living in Distress. I am here tonight to call on you, the legislators of St. Lawrence County, to pass a resolution to cease the placement of St. Lawrence County foster children into the homes of DSS employees, a practice that very few counties allow. Earlier this year, when Mr. Button was asked about the legality of this issue, he responded, quote, "But is it a practice the county should engage in? I know some counties have come to the conclusion that it is not. I agree that it is not, and at the very least, it gives the appearance of impropriety, which is something this county should avoid at all costs. Let me explain to you why this is a conflict. First, when a DSS employee fosters a child, a conflict arises from that child being placed in the care and custody of that employee's employer. That child's case being managed by that employee's friends and coworkers. In that case, that child's case updates being communicated by and through said employees. This brings into question if due diligent efforts are being made for reunification, if that child is getting preferential treatment, and if that employee is being afforded additional benefits not provided to other foster parents. Second, when a hotline call is made against a St. Lawrence County DSS employee, St. Lawrence County CPS is tasked with investigating this. The conflict arises from this investigator being friends or coworkers with the accused, and brings into question if this investigation is being handled appropriately or if leniency is being afforded. On the flip side, if a hotline call is made against the biological parent of a child placed in a DSS employee's home. The outcome of that investigation is skewed by that investigator and her personal opinion on whether that child is better off in her coworker's home. Third, DSS employees are given, quote, first dibs when it comes to children coming into care. This is resulting in comments being made such as, quote, I am searching for another redhead with green eyes, end quote. Or, quote, we are waiting for the perfect child for us to adopt to complete our family. These are children you're referring to, not decorative pillows for you to match to your home decor. These issues, among others, have been confirmed by individuals on the inside who wish to share their personal observations and concerns as they wish to be part of the solution and not the problem. In August of this year, OCFS issued a letter to St. Lawrence County DSS highlighting the deficiencies identified during the review of employee foster homes, including MAP trainings being missing from the record, criminal background checks missing from the record, and the number of children placed in these homes exceeding the regulatory capacity issued by New York State. Despite what we've been previously led to believe, employees are not being certified due to a lack of beds in St. Lawrence County foster homes. Last week, I made contact with 6 random foster homes in our county who had a total of 15 open beds. When I asked how this was possible, in a time that the county's foster care numbers were at their highest, many of these families stated that they have not been contacted about a placement in several months. I encourage you, the legislators of St. Lawrence County, to speak to the foster parents in this county and ask yourself why we are continuing to allow DSS employees to foster at the rates that they are fostering currently. I am also suggesting a future resolution or contract amendment be made ceasing the placement of St. Lawrence County foster children into the homes of employees from third-party contracted agencies such as CHJC and Fostering Futures of St. Lawrence County, as this conflict also applies to them. I welcome the employees of St. Lawrence County to continue fostering in ways that are clear and free of conflict. If members of this board deemed it appropriate, those could include taking placement of a family member through kinship placement with parental approval, taking placement of an older child who's at risk of aging out of the foster care system if no other homes are available, taking placements of a foster child from an outside county, or taking placements of a child whose parental rights have been previously terminated if no appeal is being sought. These solutions could remain reasonably free of conflict as long as an outside county provided case oversight pending the adoption or reunification of these children. I hold in my hand a petition with signatures that support tonight's resolution. Within 1 day of the creation of this petition, a DSS employee had created an opposing petition, and the nasty social media comments began. One of these posts referred to foster children as, quote, massive burdens to this county. These posts, paired with the negative comments that are regularly posted about any article published about child, is a stain on the integrity of this county. We should expect more from our county employees, and we should not allow them to conduct themselves like this publicly. I asked you to pass this resolution, not to penalize and not to take away a privilege from someone willing to foster, but because we have to ensure that everybody is abiding by a set of rules to ensure that the rights of families are not being violated. Thank you.
Erica Porter.
My name is Erica Porter. I'm from Watertown, New York. You've heard some of my story before, but if you've forgotten, my husband and I are both teachers from Jefferson County who fostered 2 St. Lawrence County children for nearly 2 years. We loved them, we still do. They're such an important part of our family. Our 2-year-old biological son misses them just as much as we do. He's never known life without them. It's not just the foster children suffering now, it's also the permanent homes they almost had. These kids are part of a sibling group of 4, and we are working hard to reunite the 4 siblings under our roof. You know, reunification of family members, which you hear DSS caseworkers say is their #1 priority. That was never our experience. We've gotten pushback from every angle when we insisted that DSS was neglecting their duty to work to reunify the siblings, or at least provide the children bi-weekly visitation. Siblings have a statutory right to visitation with each other, especially when separated in foster care. The New York State Foster Children's Bill of Rights outlines this privilege. This is a document that DSS claims to not take lightly. However, this right to visitation and reunification was denied to the 4 siblings in this case for 4.5 years. It's still being denied. These 4 children have made it abundantly clear to their attorney that they want to live together, and that if they cannot live together, they want to see each other. This is a wish that DSS caseworkers, the Voluntary Foster Care Agency, another foster parent, DOS attorneys, the AFC, and Judge Morris have all objectively denied to recognize and work toward. We're lucky because we have a really good working relationship with the birth parents. Right after both birth parents agreed to release the 4 children to us for adoption, St. Lawrence County DSS all but stole the 2 children we fostered from us, ripped them from our home and from our family. We are not accused of any crimes. Our personal and professional records are spotless. Any allegations of abuse we were wrongfully accused of were unfounded. Despite the presumption of innocence, a legal principle that every person accused of a crime is considered innocent until proven guilty, we were cast aside by St. Lawrence County DSS and our foster care agency. We were defamed by caseworkers and their supervisors to the biological family, to any possible placements for the children, and to agency staff who we had an excellent relationship with. We were not even allowed our due process rights of a notice of a removal or a fair hearing on the removal before the children were wrongfully taken from us. All of this happened without credible proof that any maltreatment had occurred. Let me reiterate that those allegations were unfounded, and yet our children still have not been returned to us, despite the outcome of the CPS investigation, despite the fact that their bio parents deserve a chance to pick the forever home for their children. They still have their rights. We don't even need an apology, although one would be nice. We just want our children back, no questions asked. Our only fault is advocacy for children to be placed with their family. What's the wrongdoing in that? What I don't understand is how an agency that's directly responsible for negligence in the cases of the death of a 10-year-old girl, a 13-year-old boy, and an 18-year-old girl, an agency that kidnaps babies from other states when they can't even take care of the 350 plus foster care kids that they have. How can this agency be so quick to call my husband and I abusers without ever meeting us in person, without ever stepping foot in our home? That's what members of St. Lawrence County DSS did. They perverted our actions, twisted us into our awful people, tarnished our names in the community, but only after punishing us and our advocacy by taking 2 out of the only 3 things in this world that we would die for, our kids. They used our children as pawns to teach us a lesson on who's boss. They denied us the right to an unbiased conference on the removal when they moved our children into an overcrowded foster home an hour and a half away from their school, their doctors, their church, their sports practices, their friends and family, and they enrolled them in a new school. It was clear from the beginning that St. Lawrence County didn't intend to give us a fair shot at the conference we were entitled to. They didn't wait for the results of the CPS case, which again was unfounded. St. Lawrence County DSS wanted our conference because they have the power, but we are here to take the power back. These are our kids. They're not pawns in a game of who's right and wrong. These are families being picked apart and discarded based on convenience of caseworkers. Collectively, with Claudia Fantone as our leader, Child will advocate for change and for a complete overhaul of this extremely broken system. You either recognize the shortcomings of this system and its need for change, or you ignore it. What are you doing proactively to rebuild the system that so badly needs it? It shouldn't take public outcry and tens of thousands of dollars for people to do the right thing. We're supposed to be on the same side, and that's doing what's best for kids. I'm seriously wondering what some people are waiting for. You have the facts, you have the truth, you've seen the OCFS report, you've heard us for months now. When will you act? Not stand aside and let a third-party investigator complete an investigation that's already been done. When will true action take place? DSS claims that their employees need to foster due to a lack of available homes. My husband and I stand here in this building, willing, able, and ready to foster children from St. Lawrence County. We have a 5-bedroom house. My in-laws live around the corner. We've got a great support system. We're both highly respected teachers. If you want to take one small step in the right direction, you can vote to end placement of St. Lawrence County foster kids in the homes of DSS employees. You can call CHJC and demand that they recommend our home for reopening. So we have a chance to help the children that DSS employees insist they care so much about. That would be a start, but there's still a long way for you guys to go.
Peggy Aiden, AIDUN, looks like. Let's stand.
Hi, good evening, everyone. As I only have a limited time, I've had to kind of cut our story a little bit short, the nightmare that we've lived through and endured at the hands of St. Lawrence County DSS. My name is Peggy Adun. My 2 grandchildren were taken by CPS in July of 2020 after I advised my son to call CPS for help because the mother of the children became a full-blown drug addict during the middle of COVID. After he opened the case, the mother refused to comply with CPS, so he was told he had to keep her away from the children, or they would remove the children from the home. My son didn't have the financial ability, or because of COVID going on, the ability to just pick up and move with the children. But this was the only thing. They told him to keep her away from the children, or they would remove the children from the house. That is the help that CPS offered my son. At the time, it was during COVID, and my husband and I were quarantined. My husband had just gotten out of the hospital. And we were being very careful. No one had gotten vaccinated yet, and we were being careful. We hadn't seen the children in person since March, and they were removed in July. We had only seen them through FaceTime. My son would FaceTime with us. And also, we'd go to the house and wait through the window and drop them off gifts. This is a very difficult time for my son because that was the only option he was given. He wasn't given any other options or any other help or any other alternatives from CPS except to keep the drug addict mother away from the children. He called the police several times over and over and kept in contact with me 3 or 4 times a day while he was going through all of this with her. He didn't know what to do. And I suggested he call CPS because I couldn't take the kids at that time until he could figure the situation out. And what had happened is she continued to show up at the home and he would call the police to have her removed. And the police, her name was on the lease and the police refused to remove her from the home. So legally, he had no choice. He could not remove her from the home and he didn't have the ability to move himself and the children from the home. So I was contacted by CPS and I was asked to call my son and try to get the kids out of the home because they were going to remove them with an emergency order. I asked them if they would quarantine the children for 10 days and bring them to my husband and I. That was the plan that they made with me. I proceeded to go from Potsdam to Ogdensburg. I called my son and asked him, can I take the kids out of the situation? And that's what we're gonna do. When I left, I went and picked the kids up at my son's home. And when I left, I was in contact with CPS the entire time. When I contacted CPS with the children in my car, my husband and I, this was the first time we were seeing them since March. So we, of course, pulled over the car, got them out of the car and held them and hugged them and cried. And we called CPS. And I almost said a name. We called CPS because we were in contact with them. And we explained to them that we did not feel that the children needed to go through this. We were already exposed to them. At that point, if we got COVID and died, we got COVID and died because it was that heart-wrenching. They're our grandchildren. We were with these children from the day they were born every single day of their lives. They were at our house for Christmases, for holidays, for everything. CPS told us at that point over the speaker of our car, we were on our way back home with the children, told us to pull our car over immediately. That if we did not, my husband and I would be arrested because they had a court order to remove the kids. So we pulled over at Moore Backs and Sons, and we asked for a sheriff to be called to make sure that their paperwork, that we had to turn the children over, we were not turning them over willingly. At that time, the sheriff came, and I stayed in the car with the doors locked with the children. My husband got out and talked to the sheriff, and he talked to his supervisor and notified us from their paperwork that we needed to return the children, to give the children to CPS. At that time, my son had texted me and asked me if everything was okay. And I said, no, we are pulled over at Moore Backs and Son, and CPS is here in the police. And my son showed up. And at the time when he showed up, do I need to stop? I'm sorry.
Could you button it up with just real quick sentence?
I'm really trying.
You're way over, man. I have to be.
Okay, I would just like to finish up as much as I can. I'll try really hard.
I'm gonna be able to let you go through the whole thing.
I won't go through the whole thing.
I'll give you a minute.
I really appreciate that,
I'm
sir.
bending the rules for you, but no one else, so.
I really appreciate that, sir. There's a lot to say and I made it really short, but I'll try to get to the end. So we were told at the time they were taken that my husband and I would be notified the next day of their placement, and we would be given visitation until they could be quarantined. The next day, in retaliation for not turning the kids over to them, we were no longer being considered for placement of my grandchildren. They took my grandchildren and placed them in another home. 3 weeks later, placed them in Jefferson County, out of our county. My son has been traveling for 15 months to see my grandchildren for visitation, never has missed a visit. Now, my husband and I didn't see my grandchildren, we were kept away from them. For 14 months, we just seen them a month ago for the first time. I just, one last thing, please. This is last thing for first Department of Social Services.
Really bending the rules for you.
I'm sorry, I'm here today to ask you all to please look into their unethical misconduct and protect our children that are being used as pawns by our St. Lawrence County Department of Social Services. I really thank you for your time and consideration. I'm sorry for taking so much of your time.
Okay, Patricia Langstaff, RN, Augsburg.
Hello. Thank you for having me. I wish I was here to make everybody laugh, but I'm not. I'm here to talk about the dealings, the frightening dealings I've had with CPS, St. Lawrence County Department of Social Services. It's been a terrifying ride. I'm quite concerned for my child. Let me just give you a little history. I'm a 21-year employee at Claxton Hepburn Medical Center. Chances are I may have taken care of some of you. I've worked medical, surgical, obstetrics, and most recently back on mental health, my home where I love. So I come to you not as a perfect person, flawed, but I fought really hard for my child since the day she was born. I'm the only one, actually. Her father's been consistently absent. He's a convicted felon, and right now, as recommendations by Jane Garland and CPS, it's recommended that my child, my 4.5-year-old, be placed with him. Yeah, it's pretty concerning, but there's also concerns I have on the other end as, you know, a registered nurse. I've seen I don't even want to say inconsistent because it's too kind of a word to say of the dealings, the situations, the decisions that go on in the placement or the taking of these children. I've seen children that were given to a mother positive for cocaine, benzodiazepines, and marijuana, but taken from a mom who was positive for marijuana, but also had some domestic violence issues. I don't know, it's confusing to me, it's twilight zoning to me as a nurse, like we get a procedure and we follow it through and through, it doesn't really vary. There's also scales that we have as a nurse, to things like to detect early warnings for, let's say, sepsis, to decide how serious a problem is. I don't see where any of the systems are in place at DSS. I see a lot of unchecked balances, and I want to challenge you right now, because as a nurse, when I contact a physician with a concern, you set the scene, the patient, this is the concern, this is what I recommend, but ultimately the order comes from the doctor. I see a lot of heat on DSS right now, but I'm not hearing anything about where these decisions are coming from. They aren't made by DSS employees, they're recommendations. They're followed up by orders by a judge. It's also concerning that, I'm involved with Renewal House. They're great people. It's just alarming when you get a call the day before your permanency hearing to warn you about the mood and tone of a certain judge involved in your case, and to be very careful. It's very scary. The tyranny is real. There is serious abuse of power going on right now, and children's mental health and physical health, I do believe, are at stake. I brought concerns to my 4.5-year-old child this summer. We were falling to pieces after doing everything to get my child back. We both were falling to pieces, and I can't lie, I'm lucky to be standing here alive, but I am, and I'm glad to make it through. But my 4.5-year-old this summer made comments that she just wanted to run out into the middle of the road, and that she just wanted to get forgotten outside so that she would be kidnapped. No, she couldn't handle it anymore. She had no coping skills, and I brought these concerns multiple times for months to these people with nothing. And then finally, they said that she could get some treatment. It would come out of my visitation time, but yeah. So very scary times. Thank you very much for having me. I appreciate it.
Patrick Green, Lisbon. Rachel Raven, Governor.
He's Patrick.
What's that?
What
was the last name?
We were looking for Patrick Green.
Green. Patrick Green.
Good luck.
You can't miss them.
I know it's called.
Well, go ahead, and then he'll come in when he comes in,
Sure.
after you.
Nope, that's not bad.
Patrick Green. Wrong Patrick Green.
He left and gave me his proxy. I told him I'm trying to do him proud, sir.
Okay, go,
But I'm gonna use a little different approach.
go ahead and, do you have your own presentation?
Yeah.
Go ahead.
Instead of telling another,
Do you understand,
Order story.
before you start, did you get the directions on what the rules are, like stand there and then do the 5-minute presentation?
Yeah, it's gonna take 5 minutes.
All right, go ahead.
Now,
Your name?
David Smith, I'm a 58-year-old grandfather. The stories I've heard are heart-wrenching, deplorable, despicable for this type of criminal activity to be allowed to take place. Okay, now I'm gonna try not to mention any names of the I'm not a professional, I'm just a retired correctional officer. But I'll try to maintain my professionalism. Almost 3 years ago, I sent an affidavit to the New York State Attorney General, PIV. So I'm about 3 years ahead of Phillips software. I gave this to what was told to me, a joint investigation. Because of the people that were there, it's not only a joint investigation, it is a criminal investigation into CPS's conduct. Okay? I gave that to the highest ranking legal officer here in the county. Can I use his name? Is there an attorney in the room that knows who I'm talking about with that description? Mr. Lightfoot?
Yes, sir. What?
You know who I'm referring to?
Well, I would assume you're talking about the county attorney or the district attorney?
District attorney. District attorney.
You can use his name as public witness.
Okay. Mr. Pasco received this affidavit. Same time I sent it certified mail. It's part of the investigation. It will be part of the investigation if and when there's a class action lawsuit against New York State and others. So I would like to make sure everybody has a copy of that. And back almost a year ago, because I was told by a senior investigator from the state police out of Raybrook, signing major crimes, told me, we work with CPS. You need to get a hold of your county board of legislators. To the best of my knowledge, the highest ranking law enforcement official in the state is the Attorney General. When this letter was sent to whoever was Attorney General then, Mr. Cuomo was still governor. We got a new Attorney General now. So I'm not a politician, so I don't know. But anyway, I would like to make sure, because I spoke with a couple of legislators I have become familiar with over the years. And both of them told me that they never received this complaint. Can I use their name, sir?
Legislators?
Yes, elected officials. Or would you prefer me not?
I prefer you. Well, go ahead. You know, I'm not going to change the rules.
Not to single anybody out in the room. Mr. Forsythe, do you remember speaking with me via phone?
I do.
About this subject matter? Mr. Sheridan, same question.
I do.
All right, so don't say you didn't know about it. Now, in my family situation, there was also a death, December 1st, 2016. Anyone that I approached in any capacity as a local official, local law enforcement, county law enforcement, state law enforcement, because I personally believe the primary role of any law enforcement agency is to protect and serve the public. All these people out here are public constituents. That's it, ladies and gentlemen. Thank you for your time. I thought there was 15 of you guys and ladies.
The Patrick Kern thing, do you have that in writing?
I never contacted Ms. Curran.
Oh, Patrick Green, I mean, Patrick Green.
No, but it was witnessed by a couple of law enforcement
I think we'll
officers.
have Mr. Green speak for himself.
Well, that was for me. He left because he got.
Yeah, that's what I mean.
He's an old guy like me, and he hasn't learned self-discipline yet.
Thank you very much, that's true.
All right, now you, sir.
Thank you.
All right. I'm only trying to do my civil duty. And this is about the children. The victims are the children. We have 4 homicides that I know, and the untold emotional Tron.
Your time's up.
Boy, 5 minutes.
All right. Rachel Raven.
Oh,
Yes.
oh, I didn't work this way. I just worked it next. Yes, sir. So do I, sir.
Go ahead.
Good evening, Rachel Raven, Governor. Thank you for meeting here tonight, meeting with us. We continue to be a voice for the children. Month after month, we come in anticipation and hopes of action. We see some resolutions proposed, and I'm here today to ask that they're not tabled, that they're not put off, that we discuss the issue, we vote, and we move forward with solutions. That's what the vulnerable, misused, and abused by the system children need, is your action. We the people. There's not gonna, there will always be people that oppose me, that oppose us as the child organization. I'm not called to be a people pleaser. I am called to speak truth. I am called to speak up for the vulnerable, and that I will do. I'm sorry if that makes anyone uncomfortable. We the people. We have a petition, there's not enough signatures on it, about the foster care in the St. Lawrence County. I will provide Mr. Sheridan a copy. In the short time it's been posted, we have 381 signatures. We have a lot more people standing for our children than 381 people. We have 267 people following us on social media. And let me tell you, we have a lot more people behind us. We have people that are moving forward with certain court hearings within CPS that are supporting us behind the scenes, but they cannot come forward at this time due to retaliation. When we get to the legal entities, hopefully this year, but perhaps 2 or 3 years out, we'll have a louder collective voice. I'm here today, here's the petition, give you a couple copies, to let you know that if the resolution proposed is not discussed and moved forward with, and we have no action, I am going to spearhead a bi-weekly peaceful protest that you can find outside of CPS and you can find outside of this court building. That will happen after next month's meeting. I want actions and I want answers. 3 years will be in January that I have been separated from my children, that my children have went without proper intervention. And I am pleased to say that I got 5.5 hours with my children supervised this last week. It was the first Halloween I got to spend with my son. I haven't seen Christmases, Thanksgiving, you guys know my saga. Nobody cares, that's fine. But we the people collectively care for the children in this county. Cherokee County in North Carolina, near where I have relatives and visit often, had the CPS commissioner just charged with 10 felonies. 2 caseworkers faced 10 felonies and multiple allegations, multiple additional charges. There will be consequence to ripping our families apart. There will be consequence to ruining our children and causing mental health, physical health, and everything in between, causing death to poor, innocent children. Consequence that maybe the Lord will have to carry out in due time. There may not be any justice left. But until the day that I pass, I will be here to advocate for our group. Now, I know there was 8 resignations within CPS. Maybe one, I believe, could have been a retirement in the last 5 weeks. So I know in months to come, I'm gonna hear there's staffing shortages, there's, you know, the ongoing saga of what I call excuses. I know I'll likely get my 5 to maybe 6 hours a week with my children. I doubt I'll see them for the holidays, but I will not stop. I want the resolution, either the proposed, modified, or any resolution, somebody to take us serious. And until then, we'll just collectively get louder. And I do believe that we should be in a different location, because part of our presence is collectively hearing each other in person and sharing in the emotional response. So I'm proposing an alternative location next month. Thank you.
Kaylee Myers, Messina.
First, I want to start by saying thank you for at least making an attempt by approving for the hiring of more staff for the CPS workers and for the investigation. However, that's not enough. It's really not. These workers could still continue to do the behaviors that they've done, which is borderline criminal. You have fraud documents, which I have in my case, and I have proof. You are risking liability as legislators for allowing this. You are voted by the public to represent us. We have come to you. In fact, until this happened, I wasn't even aware how many times people have come to you to represent us, to help find solutions. Not to have party versus party, but to have people with people making solutions happen. And yet, in tonight's meeting, I don't see any resolution on this situation. Families, humans are being ripped apart. People are losing their jobs. People are losing faith in what you were voted in your places for. Including you guys as well on the screen who happen to roll your eyes occasionally and not pay attention. It is observed. We put our faith in you and put you in these places for a reason. How can we continue to do this when we're being knocked down? Connections system, which an IT investigation would be a great resolution because they have 15 days with a draft per the actual manual and that can be deleted. Therefore, notes can be altered and updated. Has that been looked into? Foster care issue. Title 4E of the Social Security Act, foster care adoption assistance, allows licensed agencies to claim foster care maintenance payments for up to 2 weeks when a child is placed in child care institution that's approved. So if a worker is a foster care parent and allowed to get these maintenance payments after a child is placed in this institution for 2 weeks, then the allocation of funds that the federal government has allowed to our county through OCSS has now been misappropriated. I believe that is almost bordering a federal crime. So yes, money does actually factor into it a little bit. Not to mention the stories that you guys have heard over and over and over again. Are you listening? Are you really listening? Because it really makes me wonder. I'd ask you all to close your eyes for a moment, please. Raise your hand if you and your spouse have ever had a regular, cat and cat disagreement.
I didn't hear you.
I said, raise your hand if you and your spouse have had a little disagreement about something. Yeah. Yeah. You are now at risk of being indicated as a child abuser. And unless you get a lawyer like me and my husband did and send a letter with intent to sue, you won't be heard, you won't be called back. 15 minutes after that letter was sent, we got a call from the supervisor. Why does it take that kind of action? You guys are put in this position, not us. You were voted here. You chose to run for these positions. Please show us that we did the right thing by choosing you. And please show us that you respect us as your community. Your body language shows a lot. And sometimes it's very sad and disrespectful. Thank you.
Thank you. I don't have anyone else's name on the list, so I imagine that is it.
I know I'm on the list to speak.
You're on the list?
Yeah.
What's your name, sir?
Rodney Belkey, Ogdensburg, New York.
No, it's not on this list.
There was 2 pages.
I got both of them here, but go ahead and speak.
My name is Rodney Belkey. I don't really do good with crowds, so I'm going to do my best here. Last year, in May of 2020, I opened up a CPS case in hope that I could get some help. I had, my children's mother was abusing drugs, methamphetamines, running the streets every night while I'd be home taking care of my children. I called CPS because I wanted help out of the situation. I wanted a place to go. I wanted some help. The only thing they could offer me was keep her out of the home, we're removing the children. I didn't have a choice to keep her there, and they only shared a lease together. I didn't have the finances to move, to go anyplace else. I called up CPS and thinking that my community, my county that I grew up in, that I trusted all these years might help me. The only thing they could do was remove my children. Since my children have been removed this past 15 months, I've done everything the CPS has asked me to do. I've done everything the family court asked me to do. I attended chemical dependency for a short time until they released me because I was under the influence of marijuana. I cleaned myself up. I got up, they let me go from chemical dependency immediately within the first few weeks of my first family court date. I took parenting classes. I completed it. I have a certificate in it. As prescribed by St. Lawrence County Department of Social Services. What good that is, I don't know. I completed anger management, offender accountability courses. I have certificates in those as well. Because as I know it, and I'll speak up and I'll admit my wrongs, it wasn't right for me to fight and argue with my children's mother in front of my kids. And I take full responsibility for everything that I have done. I make weekly visits with my children 2 days a week, on Tuesdays and Wednesdays to CHJC in Watertown. I have to drive back and forth to Watertown weekly, or find a ride or transportation there, or figure out a way to be there. I meet with my children for 2 hours on Tuesdays and 2 hours on Wednesdays. I get a maximum of 4 hours a week with my children. There was a CPS case I opened up on the foster parents here back in July. My son, I had been called that my son had been falling down the stairs and broke his clavicle and his collarbone. I've fallen down the stairs many times as a child. I don't ever remember getting that hurt, or I broke a collarbone. They were brought to the hospital. My son was brought to the hospital. They told the hospital that my son had fallen down the stairs. Once the CPS case was open and CPS was involved, the foster parent changed their story too, which I don't know why anybody else can't see this, that my daughter, Madeline, had pushed him down the stairs. What were they playing at the top of the stairwell? Why were they playing in an unsafe environment or an unsafe position to begin with for such a thing to happen? A week goes by, a few weeks go by, maybe a few weeks, I get another phone call that my son had an accident. He'd fallen out of the stool while he had his arm in a sling while brushing his teeth in the foster home. The foster home they are in, the gentleman works for St. Lawrence County. He's the grandfather of my children. He's worked for the county for many years. He works with the dump and stuff like that. I don't know, I'm not sure what ties he's got or if he's got any at all. But something's going on here. I've done everything I'm supposed to do to have my children reunited with me and back home where they belong, with the caring loving father that I've always been to them children. There has not been one visit log to CHJC that I haven't signed off on that has been bad or against me in any kind of way of being a parent. They can't even as little as give me unsupervised visitation in 15 months of doing everything I was supposed to do, let alone send them home for weekends or to have time outside of CHJC. I have to literally sit in a building, in a room, 15 months out of the year to visit my children, supervised with somebody in my face. What is wrong with the system? It's broken. I cry about it every night. I can't even go to bed and sleep at night. I have another child on the way. Somebody went to that CHJC. I had it with another mom. He told me that when that child's born, that I better not be around it. I'm supposed to separate from my new child's mother. So yet another family to be broken up. They want me not around that child either. I was warned that I should not be around that child. How? I've done everything that was asked of me. Everything. What's anybody gonna do to help me? What's this county? I'm done.
Rodney Pelkey, correct?
Yes, sir.
It was my error. I had you checked off and didn't see your name.
Yeah, I'm not sure how that happened.
That's my issue.
All right, thank you.
Next, we have a couple more people. Josh Collins.
Take it. Okay, go ahead. My name is Joshua Collins. I'm from Messina, New York. I didn't prepare a speech, so I'll do my best to keep it short and sweet. My daughter Annalise Collins passed away last year. It was 12/26/2020. On my oldest daughter's birthday. The coroner and even in the CPS report said that anybody with the brain that had had any contact with her should have seen something very wrong with her and done something. In their own reports, they have been there several times that month and several months before. So I beg you, I implore you, for another parent standing up here that had to bury their child, please make some changes. Thank you.
Jameson Porter. She already gone? Jameson Porter.
Eric spouse.
I think we got it. What's that?
Boob's her spouse.
Yeah, it is.
Yeah.
Husband.
Yes. Give me a second.
State your name, please.
My name is Jameson Porter. I say good evening to everyone. I'm a resident of Jefferson County, living in Watertown. I know you've all had the pleasure of meeting my wife, Erica. Growing up, I learned the value of hard work, dedication, and doing the right thing. A man provides for his family, supports his spouse, and takes care of his children. He goes to work and puts in an honest day and leaves his troubles at the door so he can be there for those he loves. What does he do when trouble follows him home? The same thing he always does, just makes his shoulders a little bit broader so his family won't have to deal with it. What does he do when the trouble is not there for him, but for his whole family? How does he shoulder the burden of having his children taken and his name slandered? He works harder to do what is right and correct what's been wrong. What I'm describing is what many families are going through in St. Lawrence County, and unfortunately, my family has been pulled into this situation as well. Around 3 months ago, my children were taken from us unjustly. Yes, I say my children, even though they are foster, because regardless if I am their biological father or not, I think of myself as their father. Around 2 years ago, my wife and I became foster parents, and we were fortunate enough to have 2 children come into our care who we grew to love and cherish. After 18 months of no issues and us being called the model foster family by our fostering agency, we suddenly became the target number 1 of several agencies who didn't agree with our advocacy for reunification. 2 more siblings in separate housing facilities were kin to the children in our home, and it was our hope to get them placed together. We had the resources, reached out to the appropriate people, and filed the correct paperwork. So how is it we became a target and working toward what St. Lawrence County DSS is so committed to? We didn't fit the mold of what the St. Lawrence County DSS wanted. The St. Lawrence County DSS website of Children's Services states under the Preventative Foster Care Services, and I quote, works with children in foster care and birth parents in order to remedy problems and reunite family if possible. Works closely with foster parent and other service providers, end quote. So what does St. Lawrence County DSS define as working closely? Home visits, support groups, constant contact with children's service providers, or maybe it's answering an email on time, contacting foster parents, asking how they can be supported, speaking with the children under their care to see how they're doing. It is safe to say that my wife and I were never able to experience this commitment of working closely. We never had anyone from St. Lawrence County come to our home and speak with our children. In fact, they have seen our home just as much as everyone else if they were to watch the news. The St. Lawrence County DSS website of Children's Services also states under the adoption tab, and I quote, recruits, trains, and certifies foster and adoptive homes. Works with children free for adoption to place them in adoptive homes, facilitates adoptions. It seems they recruit those families who have personal connection to their agency, or those they can train into doing what they say without question. And they pull the certification just as quickly as they certify if that family doesn't fit into their agenda. Those families being targeted are the ones that are well educated and know that what is going on in this county isn't right. Those families who won't sit down and be bullied by an agency who claims to be working in the best interest of kids. How many of us work 40 hours a week and then call it good? 50? 60? Some of us even put in 65. How many here would work an extra 2 hours for nothing? An extra 5 hours? How about an extra 10? How many times has a DSS employee clocked out at exactly 40 hours, letting important calls or emails wait until the next week while a child is in crisis? Or find it's easier to say no rather than we can try? How many hours would you put in to get your kids back if they were taken? The truth is, there's no set amount of time that anyone would work to get their kids back safely in their home. When a DSS caseworker clocks out at 40 hours, it's people like Claudia Fantone and my wife Erica putting in that extra time. For the past 3 months, I have watched and worked alongside my wife as there have been extra days worth of work put in on top of our regular jobs. To clear our name and do what is right to get our kids home. Not extra hours, extra days, with the only compensation being hope that our children will be returned to us. This has turned into an opportunity for my wife working towards the righting the wrongs committed by these trying times, by these agencies upon other kids, as well as the families they've manipulated. Not only have we both become members of the organization Child, my wife has become the spearhead of a Jefferson County Child chapter, ensuring that these intolerable actions are corrected and will not be repeated. I urge you to look at how your departments are treating the people within your community and ask yourself why there are so many issues. Thank you.
Next.
We are going to see the video. Dylan's gonna put that together.
I'm Dottie. Evaluate what I want tonight. DSS employees and/or their friends have taken to social media. It is extremely ironic that child has been blamed for causing a commotion over our concerns, but yet we have done so without calling DSS employees out by name publicly. One specific employee has been called out by name on social media by coworkers and/or friends. They have put her name out in public, which I have previously sent you an email showing you proof. Unfortunately, this employee is also the same DSS employee, foster mother that has my grandson and wants to be a permanent placement, knowing that his family is taking every step necessary to get him to his family that love and want him for no monetary stipend and not to keep for our own motherly instinct she must be feeling since her two own children have or will be reaching adulthood, and the last will be graduating in June. This DSS employee chose a newborn white baby, which she illegally acquired and placed with her since DSS will not place him with kinship care, which would save your county thousands of dollars. It is a growing concern that DSS is using delay tactics to further keep my grandson away from his family for their own that I will not discuss tonight. I became very agitated when one social media post said, and I quote, "My friend, DSS employee foster mother's name put here. Her husband and child helped to take a massive burden off our foster system. Blah, blah, blah." This DSS employee must agree because she did not dispute this comment in her reply. Now my grandson is a massive burden and she wants to be a permanent placement for him? The same DSS employee, her friends, and coworkers have patronized nonprofit groups, and it has been stated she drained them dry. This DSS employee has coworkers and friends requesting handouts for the children in her care. I also emailed you proof of this. It is my opinion that she uses stipend she is paid for the foster children's care for her own personal gains and lifestyle, all the while seeking handouts for the foster children that have been placed in her, quote, certified, unquote, foster home. This brings into question if DSS required her to complete the required criteria to even become certified before children were placed in her home. As you, the trusted, elected, and paid legislators of St. Lawrence County have seen in the letter from OCFS dated August 13th, 2021, which calls into question the, quote, deficiencies, unquote, occurring in St. Lawrence County DSS. The foster parents were DSS employees. All families requesting to become foster parents must complete MAP training and criminal background checks to become certified before children can be placed with them. My husband and I have completed said requirements. OCFS found DSS employees, foster homes, did not have this information documented. Why? Everyone listening tonight needs to no longer wonder or call what child has revealed as a commotion. There are many ethical, moral, and legal concerns that have been hidden, and child has uncovered and brought these to attention. Facts that you should have been aware of and taken steps to rectify a long time ago, since you are responsible to oversee the Department of Social Services. You have been trusted to protect the children and families St. Lawrence County DSS have tortured and traumatized, and they continue to do so. It is finally time you have become involved with this commotion to stop the torture and trauma. Always remember, we have respected DSS employee privacy. DSS employees and friends have not. I am also requesting that as the Bonadio Group investigates our complaints, that Child's Director, Claudia Fantone, is included in each of our interviews. She continues to volunteer and put forth so much personal time and energy in helping our families that have been tortured and traumatized by DSS, and she should be included in the Bonadio investigating interviews. Thank you. Good evening. I'm Dottie Spears. Sadly, I
Okay, time for presentation of resolutions. Do we feel need a slight recess? Or are we all ready to go? Recess? We'll have a little recess. Recess. Let's do it.
work here.
Does anybody want water? I can deliver. We've got.
I do.
You didn't get one?
Yeah. Could be.
Could be. No, we've got these for everyone. Anyone?
Mr. Lightfoot.
Mr. Chairman, I offer a resolution modifying the 2021 budget for the Emergency Rental Assistance Program, ERAP, for the Department of Social Services and move for its adoption.
Seconded by Mr. Burke. Roll call vote. No, how about discussion? Any discussion? No discussion? Roll call vote, Kelly.
Fay,
Yes.
Haggard,
Yes.
Fiaco,
Yes.
Burke,
Yes.
Arquette,
Yes.
Terminelli,
Yes.
Curran,
Yes.
Reagan,
Yes.
Forsyth,
Yes.
Lightfoot,
Yes.
Sheridan,
Yes.
Smithers,
Yes.
Janisha,
Yes.
Perkins.
Yes.
Akers,
Yes.
15 yes.
Carried. Mr. Lightfoot.
Mr. Chairman, I offer a resolution modifying the 2021 budget for social services for adult protective services grant, move for its adoption.
Seconded by Mr. Smithers and Ms. Kern. Any discussion? No discussion. Roll call vote, Kelly.
Haggard,
Yes.
Fiaco,
Yes.
Burke,
Yes.
Arquette,
Yes.
Terminelli,
Yes.
Curran,
Yes.
Reagan,
Yes.
Forsyth,
Yes.
Lightfoot,
Yes.
Sheridan,
Yes.
Smithers,
Yes.
Janisha,
Yes.
Perkins.
Yes.
Akers,
Yes.
Fay,
Yes.
15 yes.
Resolution carries. Mr. Lightfoot.
Mr. Chairman, I offer a resolution modifying the 2021 budget for community services for funding received from New York State OMH to St. Lawrence County as pass-through funding to Northern Regional Center for Independent Living and move for its adoption.
Second by Ms. Kern and Mr. Smithers. Discussion? No discussion. Roll call vote, Cal?
Fiaco,
Yes.
Burke,
Yes.
Arquette,
Yes.
Terminelli,
Yes.
Curran,
Yes.
Reagan,
Yes.
Forsyth,
Yes.
Lightfoot,
Yes.
Sheridan,
Yes.
Smithers,
Yes.
Janisha,
Yes.
Perkins.
Yes.
Akers,
Yes.
Fay,
Yes.
Haggard,
Yes.
15 yes.
Resolution carried. Mr. Lightfoot.
Mr. Chairman, I offer a resolution modifying the 2021 community services budget for funding received from New York State OMH to St. Lawrence County as pass-through funding to approved agencies and move for its adoption.
Seconded by Mr. Burke and Ms. Kern. Any discussion? No discussion. Roll call, Kelly?
Burke,
Yes.
Arquette,
Yes.
Terminelli,
Yes.
Curran,
Yes.
Reagan,
Yes.
Forsyth,
Yes.
Lightfoot,
Yes.
Sheridan,
Yes.
Smithers,
Yes.
Janisha,
Yes.
Perkins.
Yes.
Akers.
Yes.
Fay,
Yes.
Haggard,
Yes.
Fiaco,
Yes.
15 yes.
Carried. Mr. Lightfoot.
Mr. Chairman, I offer a resolution authorizing the chair to sign contracts with various organizations for youth development programs and move for its adoption.
Seconded by Ms. Kern, Mr. Smithers also. Any discussion? No discussion, all in favor?
Mr. Nelly had a.
Mr. O'Malley? Go ahead,
Sorry,
Mr. O'Malley.
I just need to recuse myself from this vote due to my affiliation with an organization on the list.
Okay, noted. All in favor?
Aye.
Opposed? Carried. Mr. Lightfoot.
Mr. Chairman, I offer a resolution authorizing the chair to sign the 2021 resource allocation plan signature page and move for its adoption.
Seconded by Ms. Kern, and Mr. Forsyth. Discussion? No discussion? All in favor?
Aye.
Opposed? Carried. Mr. Lightfoot.
Mr. Chairman, I offer a resolution authorizing the chair to sign a contract with the Community Health Center of the North Country for the Community Friendship Volunteer Program and move for its adoption.
Seconded by Mr. Denisha. Any discussion? No discussion, all in favor?
Aye.
Opposed? Carried. Mr. Lightfoot.
Mr. Chairman, I offer a resolution modifying the 2021 budget for the Public Health Department to accept additional funding from the New York State Department of Health for the COVID-19 vaccine response and move for its adoption.
Seconded by Ms. Kern and Mr. Smithers. Any discussion? Roll call vote.
Arquette,
Yes.
Terminelli,
Yes.
Curran,
Yes.
Reagan,
Yes.
Forsythe,
Yes.
Lightfoot,
Yes.
Sheridan,
Yes.
Smithers,
Yes.
Denisha,
Yes.
Perkins, Akers,
Yes.
Fay,
Yes.
Haggard,
Yes.
Piacco,
Yes.
Burke,
Yes.
15 yes.
Resolution carries. Ms. Kern.
Mr. Chairman, I have a resolution authorizing the creation of a reserve for public transportation revenue, and I move this resolution.
Seconded by Mr. Forsythe. Any discussion? No discussion. Roll call vote. Kelly.
Terminelli,
Yes.
Curran,
Yes.
Reagan,
Yes.
Forsythe,
Yes.
Lightfoot,
Yes.
Sheridan,
Yes.
Smithers,
Yes.
Denisha,
Yes.
Perkins,
Yes.
Akers,
Yes.
Fay,
Yes.
Haggard,
Yes.
Piacco,
Yes.
Burke,
Yes.
Arquette,
Yes.
15 yes.
Carried. Ms. Kern.
Mr. Chairman, I have a resolution authorizing the chair to appoint the county planning director as the certifying officer for the environmental review as required by fiscal year 2021 CDBG CARES Grant Award, and I move this resolution.
Seconded by Mr. Akers, seconds it. Any discussion? No discussion. All in favor?
Aye.
Opposed? Carried. Ms. Kern.
Mr. Chairman, I have now a resolution authorizing the chair to sign a contract with the New York State Office of Community Renewal for a community development block grant for fiscal year 2021 of the CDBG CARES Grant Award.
Seconded by Mr. Forsythe and Mr. Fay. Any discussion? No discussion. All in favor?
Aye.
Opposed? Carried. Ms. Kern.
Mr. Chairman, I have a resolution authorizing the closure of a capital project for the website redesign project, and I move that resolution.
Seconded by Mr. Smithers and Mr. Lightfoot. Discussion? No discussion? All in favor? Opposed? Carried. Mr. Raker.
Mr. Chairman, I offer a resolution determining that the purchase of real property and construction of a new truck equipment garage and a salt/sand storage building in the town of Potsdam in St. Lawrence County, New York, and will not result in any significant adverse environmental impact. I move this resolution.
Second by Ms. Kern, Mr. Smithers. Any discussion? No discussion. All in favor?
Wait.
I'll be abstaining.
Yes, you're,
I'm abstaining due to my employment.
okay, so noted, Mr. Perkins. All in favor?
Aye.
Opposed? Carried. Mr. Akers.
Mr. Chairman, I offer a resolution modifying the 2021 budget for the Department of Highways for equipment repair, maintenance, and fuel. I move this resolution.
Seconded by Ms. Kern. Any discussion? No discussion. Roll call.
Curran,
Aye. Yes.
Reagan,
Aye.
Forsythe,
Yes.
Lightfoot,
Yes.
Sheridan,
Yes.
Smithers,
Yes.
Denisha,
Yes.
Perkins.
Yes.
Akers,
Yes.
Fay,
Yes.
Haggard,
Yes.
Piaco,
Yes.
Burke,
Yes.
Arquette,
Yes.
Terminelli,
Yes.
15 yes.
Carried. Mr. Akers.
Mr. Chairman, I offer a resolution approving the 2022 St. Lawrence County Solid Waste Department fee rate. I move this resolution.
Seconded by Mr. Kern. Any discussion? No discussion. All in favor?
Aye.
Opposed? Carried. Mr. Akers.
Mr. Chairman, I offer a resolution authorizing the chair to sign an amended contract with Odin Environmental LLC for expanded environmental investigation of property owned by Grants Gas and Grocery, and for initial environmental investigation of property owned by Rosalind Salamaka, Bruce Galloway, and Fleet Technologies LLC. I move this resolution.
Okay, second by Mr. Lightfoot. Any discussion? No discussion. All in favor?
Aye.
Opposed? Carried. Mr. Akers.
Mr. Chairman, I offer a resolution authorizing the chair to sign an agreement between the New York Environmental Protection and Spill Compensation Fund and the County of St. Lawrence, New York, regarding a certain tax delinquent property owned by Betty Davis. I move this resolution.
Seconded by Mr. Kern. And any discussion? No discussion? All in favor?
Aye.
Opposed? Carried. Mr. Akers.
Mr. Chairman, I offer a resolution authorizing the chair to sign a contract with CNS Engineers, Inc. for environmental investigation of property owned by Newton Falls Holding LLC. I move this resolution.
Second by Mr. Kern and Mr. Denisha. And any discussion? No discussion. All in favor?
Aye.
Opposed? Carried. Mr. Akers.
Mr. Chairman, I offer a resolution authorizing the chair to sign a contract with the St. Lawrence County Fire Training Facility, Inc. for priority use of the George E. Griggs Fire Training Center by participants of the St. Lawrence County Self-Insurance Plan. I move this resolution.
Seconded by Ms. Kern. Any discussion? No discussion. All in favor?
Aye.
Opposed? Carried. Mr. Akers.
Mr. Chairman, I wholeheartedly offer a resolution reallocating funding from the Comprehensive Opioid Stimulant and Substance Abuse Program, known as COSAP, site-based grant to St. Lawrence County Community Services to develop and operate an opioid treatment program in St. Lawrence County. I move this resolution.
Seconded by Mr. Lightfoot. Any discussion? Yes, Ms. Kern.
I would like to be added as a co-sponsor, please.
Okay, so noted. Any other discussion? All in favor?
Aye.
Opposed? Carried. Mr. Akers.
Mr. Chairman, I offer a resolution setting a date for a public hearing on the proposed local law D, number yet to be determined, for the year 2021, named reapportioning 15 legislative districts in St. Lawrence County. I move this resolution.
Seconded by Mr. Lightfoot. Any discussion? All in favor?
Aye.
Opposed? Carried. Mr. Akers.
Mr. Chairman, I offer a resolution modifying the 2021 budget for the County Administrator's Office for costs associated with court-ordered treatment services at New York State operated inpatient mental hygiene facilities. I move this resolution.
Seconded by Mr. Kern and Mr. Perkins. Any discussion? Yes, Mr. Smithers, go ahead.
I would just like to have pointed out that this is an added expense, and could you just explain that for the benefit of me and the public, as why this is added to the person of St. Lawrence County, New York State, whoever can do that.
Yes, please.
I'm sorry, I was being asked a question.
This is added to St. Lawrence County's burden from New York State.
Yes, sir.
And this is something new, and it's another pass on of burden from the state to the county.
So, Mr. Chair, if I could answer?
Yes, go ahead.
So with regard to it being new, it is not. What is new is the 100% charge to the county. So formerly, we shared the cost 50-50 with New York State. The burden transferred in March, April timeframe of 2020.
Any other discussion? Roll call?
Reagan,
Yes.
Forsythe,
Yes.
Lightfoot,
Yes.
Sheridan,
Yes.
Smithers,
Yes.
Denisha,
Yes.
Perkins,
Yes.
Akers,
Yes.
Fay,
Yes.
Haggard,
Yes.
Piaco,
Yes.
Burke,
Yes.
Arquette,
Yes.
Terminelli,
Yes.
Curran,
Yes.
15 yes.
Carried. Mr. Akers?
Mr. Chairman, lost my place for a second. I offer a resolution for the authorized filling of vacancies. I move this resolution.
Second by Mr. Kern, Mr. Smithers. Any discussion?
Didn't we skip that?
Did we skip one?
No, we're good. They're doing
This
it
is
now.
number 23.
This is 23.
23. Oh,
Okay.
I see.
You skipped it.
Okay, so we're on the right one. And so there's any more discussion on that one? No discussion? All in favor?
Aye.
Opposed? Carried. Mr. Kern, Ms. Kern.
Mr. Chairman, I have a resolution modifying the 2021 budget for the sheriff's office to utilize funding from the county surplus auction to assist with the purchase of a patrol vehicle for the sheriff's office, and I move this resolution.
Second by Mr. Burke and Mr. Smithers. Any discussion? No discussion? Roll call vote, please.
Forsythe,
Yes.
Lightfoot,
Yes.
Sheridan,
Yes.
Smithers,
Yes.
Denisha,
Yes.
Perkins,
Yes.
Akers,
Yes.
Fay,
Yes.
Haggard,
Yes.
Piaco,
Yes.
Burke,
Yes.
Arquette,
Yes.
Terminelli,
Yes.
Curran,
Yes.
Reagan,
Yes.
15 yes.
Carried. Mr. Perkins.
Sorry.
Number 25,
Chairman, I offer a resolution authorizing the chair to sign a contract with the St. Lawrence County Sheriff's Supervisor Association, Inc. for 2022 through 2026, and I move for this adoption.
Seconded by Ms. Kern. Any discussion? Yes, go ahead, Mr. Forsythe.
Mr. Chair, I thought in the old days, and maybe Ruth, I should be asking you, didn't it have a total cost? Wasn't there a total cost projection, or is it too hard to do with that?
The total cost, can I answer that?
Go ahead.
The total cost projection wasn't included in the agenda. I think Johnny went over those with us, but we can provide those to you. We can add those. We can certainly share those with the public.
Any further discussion? All in favor?
Aye.
Opposed? Carried. Mr. Perkins.
Mr. Chairman, I have a resolution authorizing the chair to sign a contract with Council 82S Local 2390 for 2022 through 2026, and I move for its adoption.
Second by Mr. Lightfoot. Any discussion? No discussion. All in favor?
Aye.
Opposed? Carried. Straight.
Mr. Chairman, I offer a resolution establishing a standard workday for New York State retirement system reporting purposes. I move this resolution.
Seconded by Ms. Kern. Any discussion? No discussion? All in favor?
Aye.
Opposed? Carried. So ready for county administrator's report.
Thank you very much for honoring the service in 8 departments tonight with 13 individuals. That was a total, if you were counting, just to follow the good sheriff, 365 plus years of service were captured tonight. So very proud. And 20 of those are our legislators. It really is an honor. We're seeing so much change in the workforce that getting to 30 35, 40, and even 10 in some situations. It's really remarkable these days. So thank you very much for continuing the tradition of the longevity ceremony. Certainly, don't have to tell this group, Election Day is tomorrow. Get out and vote. And just to remind you, we do provide time by New York State law for folks to make sure they have the opportunity to vote. Next week, as a reminder, you will receive the 2022 version of these summary books that we will go through. And I just wanted to mention, because I think sometimes you see frequent flyer, so to speak, departments, I just wanted to review for you the departments that you'll see at operations for budget. So they'll include the Board of Elections, Conflict Defender, County Clerk, District Attorney, Emergency Services, Governmental Services, Human Resources, Information Technology, Planning, Probation, Public Defender, and the Sheriff. So those you'll hear, and if you have questions for those specific departments, we'd like to address those next week. And then likewise, I'll announce each week going forward. Wanted to mention to you that the offices for the county will be closed on Veterans Day, November 11th. You have this evening, courtesy of one of our visitors, Patrick Green, the poppies, the Buddy Poppies, courtesy of the Veterans of Foreign Wars Assistance Programs. But I would like just to take a minute. We are working on an initiative to designate some parking. I think I might have shared this with you probably about 3 years ago, but we're looking to make that a reality and designate some parking in our county-owned facilities for veterans. We hope to roll that out next week, as well as an opportunity to embrace Operation Greenlight. And if I can, just read a couple of sentences about Operation Greenlight. It's a collaboration between NYSAC, New York State, and the New York State County Veterans Services Officers Association and NYSEA, and the 62 counties in the state. The mission is to show support for veterans of all military conflicts, with special emphasis on Iraq and Afghanistan, as well as raise awareness about the challenges faced by many veterans and the resources that are available at the county, state, and federal level to assist veterans and their families. And so in doing so, some of you may travel through Canton in the evening and recall that about 4 years ago, we started to light up the tower here. So if there's no objection, I'd like to change that color to green and celebrate the veterans for November. Wanted to mention to you, vacancy review is tomorrow afternoon. We have 8 departments bringing forward 11 positions for discussion. And I do want to thank you also, certainly was prepared to speak to it, but in the vacancy resolution tonight under the Be It Further Resolves, you heard the conversation last week as a part of the budget presentation about addressing a little bit more flexibility associated with the positions in social services. So the 2 Be It Further Resolves that were included provide some more latitude to continue filling those positions, to move positions back and forth. It's not unprecedented. We've done it in other departments where necessary. And I think the reality of getting the positions filled, getting folks to come in, apply, and be qualified amongst the challenges we still face with testing and civil service requirements, because of the delays associated with COVID, we have a number, not only in social services, but across the county, we have a number of folks in provisional positions. So while they try to catch up, those challenges continue to plague us. So that will be very helpful with regard to the additional flexibility in CPS and children's services there. Just a few updates on committee work this last week. We were able to, with our chair of the Buildings and Grounds Committee, meet with our engineers on the HVAC systems associated with the Public Safety Complex project. So those of you who may have thought that stalled out a bit, we were only sidelined by budget and certainly a lot of attention and work going on in social services. But we were able to have a couple of conversations, sort of the good, better, best option with our chairman, and send them back to do a little bit more work. And then we'll pull the Buildings and Grounds Committee back together to look at their efforts and their latest iteration. We also talked about, in the context of the Public Safety Complex project, addressing the stairwell over there. So many of you, if not all, have been over to the Public Safety Complex for meetings in the past. And you recognize, if you think of the stairwell there, that it's a very narrow stairwell that's not meant for high traffic. Moving, or potentially with moving the district attorney's office over there and having our 911 center on the 2nd floor, we've gone to our architects and said, what can you do in this scenario? What with the existing space that you have, how creative can you be? So we're asking that they bring that back to the Buildings and Grounds Committee to try to address. we're going to see a lot more traffic through there. And as we're renovating that space, we'd like to take into consideration, and of course, price is always a challenge and a concern, but in the context of the project, figure out if we could make that a better stairwell, certainly for entrance and egress, but also to make it more travelable for the people going upstairs. So that work continues. We have our historian continuing to work. Buildings and Grounds Committee met this summer about the potential for either the old jail or a courthouse district to potentially be placed on the National Register. That certainly is of interest in the tourism side of things. We've done some work. We'd like to bring our historian, Nancy LaFavor, and a couple of folks she's been working with to operations next week for a short presentation to inform you. Often when you say the word National Register, people grimace because they're worried about restrictions on maintaining the buildings. So we'd like to educate you on that before we pursue the National Registry designation. Also wanted to thank you for considering and approving tonight the contracts. 2 of the 3 that expire at the end of this year are approved now. Both units have indicated by letter that they've approved the contracts, so that ratifies the agreement. We'll begin getting the documents finalized and getting those out. And I'm certainly happy to share the total cost of each of those agreements. And then lastly of my report before questions, on October 7th, and shortly thereafter, we shared with you that the governor has signed as a part of an opioid crisis address, Senate Bill 1795 and Assembly Bill 533, which has indicated by February 7th here in St. Lawrence County and across the state, medication-assisted treatment will be required in our correctional facilities. So we met as a group for the first time today. We assembled all the stakeholders from community services, the jail staff, myself, sheriff and undersheriff, sat down to begin working backwards from that date. And they'll begin holding meetings weekly to, one, address the challenges, but also plan logistics. I have asked that they prepare a presentation for the board, both with the cost attached, but also the program. We'd like to get information out in the public about what's being accomplished by moving this into the jail. So my hope is that will be prepared for you to come to a committee meeting in December. I think January is too late, but they'll be working through a lot of challenges as we move in this direction. And then, is there questions on that? Just have one more.
I have a question.
Sure.
Are there any funds appropriated in the Senate bill or the Assembly bill?
I believe that there are some funds coming through the SOAR grant. I can get you numbers on that. The last number I was familiar with was 60,000.
Not attached to the individual bills?
Not that I'm aware of.
Okay.
Mr. Akers?
Thank you.
In the public safety building, is there handicap access now to the second floor?
There is, there's no.
There's an elevator?
Yes.
Okay. Then I had a constituent say, what about the muddy entrance by the DSS? Are we doing construction on one of the entrances to the DSS?
Muddy entrance. Well, there's an employee entrance. The front
Is there
entrance.
construction going on or something that hasn't been completed?
I can find out. They were not that I'm aware
All right. I will do
I'll
further
find out.
investigation. I failed to do my detective work.
of. Okay. And lastly, speaking of my remarks this evening, social services. We have 2 employees out of the 4 that I mentioned to you last week that hadn't been filled. They'll start tomorrow. And we finalized our agreement with Bonadio. We have a planning call later this week, and we hope that they'll be on the ground as early as Monday or Tuesday of next week. So I'll advise you as that schedule develops. They certainly are willing to meet with you as a group, as individuals, and they'll be reporting out to you on a monthly basis going forward. And also, best news of the day, we have our initial interviews for the Commissioner of Social Services scheduled for tomorrow afternoon. And it is likely there will be another day added to that schedule. Any questions?
Mr. Burke?
The Bonadio group, they will have the freedom to go in and look at all sorts of confidential information.
Yes.
I mean, as we sit here tonight, I mean, we're at such a disadvantage because we can't know the details of the cases that are being talked about. So we're at a real disadvantage, but they can go in and they'll have that latitude to take a look at specific cases and what happened.
They will have full access, and they are familiar with the connection system that was referenced this evening, as well as the system that caseworkers use.
And if I could just add one, I'm delighted that you're using the flexibility to help fill the void over there. Do you feel you have the authority, or is it something that we need to give you to get us to a point where we have 15 cases or under. Would that be helpful if we offered a resolution to that extent to give you the authority to fill those vacancies? And that's the one thing, as we look at this, and I'm sure there will be other recommendations, but the one thing we know that the state has asked for, and has consistently asked for, is case limits of 15 and under. So if that's, I don't know, do you feel that you have that authority, or is that something we need to give you?
Well, I think in my remarks last week, answering your question about getting the positions filled, my hope is let's get all the positions already authorized filled. And I think, give me an opportunity to talk with the Director of Services over there and the staff, and we could have that conversation at Services to see if that's something. Certainly the board has the, the authority to let me do that if there's an interest to do that.
Well, my only concern is as these people come in, it's the one thing that we know. There's an awful lot we don't know.
That's true.
We'll find out with them coming in. But the one constant seems to be the 15 cases or less per caseworker. And I'm just wondering if that's something that we could begin. I know we've already begun the process. I don't mean to minimize it, but I'm wondering if we could set a target for that.
We can speak to that in our monthly, if that would be okay.
Mr. Akers, just to comment on that situation. One of the things is, one of the dangers of going by a simple number doesn't really tell the true story. And I had to rule in a case where I was chairman, and actually ruled in the employee's favor. We don't know about the productivity level too, and that really is banking on the supervisor, the oversight of doing these cases. And certainly some of these cases are much more complex than others. So I think we have to be careful. And I think it's a good metric, but I think we need to be careful about assigning, like, hey, we need to hire somebody, or if we have too many cases per individual, 17, 18, 19, or 20, versus, and then some, or the vice versa. Well, we only got 12 for somebody, then we need to let somebody go. So I don't know how you get at that, because that's really a supervisor role. And then you have all the variables about the complexity of the case. So I know that's a state recommendation. We've had other state recommendations too. But I share your concerns.
Yeah. Well, if I could just mention too what Ruth brought up, I'll tell you something that worries me, all these provisional items, because there isn't a test out now. So however many we fill provisionally, we're hoping that when the test comes out, that they'll all be reachable.
Yeah.
But the training, all the time and the effort into training, for some individuals might go down the drain if they're not reachable. So I think it's another challenge for Ruth and the department that's probably good to keep in the back of our mind. Agreed.
The only thing I would note also is with the higher level positions, so there were some senior caseworker positions created, there were some grade B positions created, and so that, and you've seen it in the monthly reports, that's created this cascade of people who, when they're promoted, they can't yet give away all of their cases. They're taking the time going through with their supervisor, closing the cases they can, and transferring. And that's why you're seeing some of these numbers be a little bit more volatile than we would normally see. And that's going to settle out here very shortly when we get everyone in the positions they're going to assume, and then we're able to backfill behind them. So I think that's going to be helpful, and then as well to look at what the cases look like then.
Forsyth.
There was one of the speakers, I tried to jot down as they were talking as much as I could, but said 8 resignations from CPS. And I didn't write the time, but it sounded like a very short period.
So I believe they said the last 8 weeks or 6 weeks. So there are 2 that I'm aware of. However, what they also may be referring to is what I just talked about. So a caseworker is no longer going to oversee a case. They're going to be a grade B, or they're a senior caseworker. That caseload has to go to someone else. So they notify the folks that the cases that they have, they'll no longer be their caseworker. So I'm not sure, but I already asked Dylan to take a look at that and pull those totals by resignation date. So we'll have an update for you on that. Yep.
That sounded like an awful lot.
That is. Yeah, we'll clarify that.
That would offset John's full concept of.
Yeah, we want to get the positions filled that you've authorized.
Right.
Mr. Lightfoot?
Tony.
Yes, Tony.
Thank you, Mr. Chairman. I think John's headed in the right direction with this, and I know that we talked about this months ago. As far as providing more help over there to DSS, and what Dave just added is a great reason to do that. And as you spoke, Ruth, we're working towards transitioning people in there that are being trained, and I'm hoping that this group will really highlight some of the downfalls that do or may exist in DSS, so that we can fix those specific areas. But I think that with the influx of folks vacating and the fact that there's a very evident need for more help in that department, I really hope everybody in the room, and I understand what Kevin's saying about cases being different from one another, but to me, I think anybody not believing that, especially the Child Protective Services portion of DSS, needs more help. And and again, if there's some way we can authorize you, Ruth, move forward with that and continue the influx and help there, maybe we can take a dent out of it, and then we get the report back and we find out what other improvements that need to be made there, to make sure that the kids are safe in our county. So I think that we're heading in the right direction with it. Certainly could never be fast enough. Certainly not for some of the folks in the room, and they may be correct, but I think that we are working hard to try to figure out a way to get to the better side of this. And I think John's advice tonight's a good start. Thanks.
Any other questions of Ruth? Thank you, Ruth.
Yep.
Any old business? Mr. Burke.
I'll try to keep it short. Last week, there was a little discussion about sales tax and fuel, and I think some good points in opposition to that were brought up. The fact that we don't want to start interfering with the sales tax revenues for our towns and villages. It may be a delicate path if we were to try to do that, but on the other hand, I think that there's many of our residents that are coming into a tough winter, and I would ask if anybody would be willing to listen to maybe the director of the CDP, somebody who has their ears close to the ground, talk to us and give us some kind of an analysis of what our community is facing and what she anticipates this winter. I'd like to think that as a group we could still do something, just stay away from the solutions that are more problematic than they are helpful. Just ask what your thoughts are.
Go ahead.
It won't cost us anything to listen.
No. Good point. Yes, go ahead.
While we're listening, I'd like to know, I don't know what the lost track, what the heat benefit is per household in a given year, and how many recipients there are to the heat benefit. I think that would be good to factor into that equation.
You can get that.
And the income level for heat, because I lost track of what.
Okay. Any other? Yes, Rita.
So, last week I sent out the little chart of what Hughes County puts out for their daily COVID information. They put out how many positives they have, what percentage of people are immunized, and then sort of by decade, how many people you have hospitalized. And so a few people have sent that to me and said, why can't we have more information? So I sort of asked Dr. Williams and Jolene to look at it. I think they're trying to figure out how they can put out information without spending all the time collecting information. They have enough to do. But people have a sort of a persistent question as to, what these patients' situations are. So, I don't know what people think. Kevin.
Mr. Jason. Two things, if I may.
Go ahead.
I'd just like to publicly thank Rick Johnson. He, a couple months ago, we talked about cybersecurity. He put on a wonderful presentation. And it was, I thought it was a kind of like a cybersecurity presentation for dummies. It was really good. He was able to understand it. And they did a great job putting it together.
I'll let him know.
Secondly, in respect to the Bonadio group, my hope is that they'll be able to get in there and identify some leading indicators. Because right now, what we're doing, we're measuring with lagging indicators. So the damage has already been done. They're not just there, but different places. So I think that if they can help by giving us some leading indicators to help us with the decision making, rather than, so we make early decisions before the fact rather than after the fact.
So in relation to,
Go ahead, Kevin.
what Ms. Curran brought up, it was basically when the first information came out about vaccination, it came from Israel, which Israel is over 80% vaccinated. And it appeared that 50% of the individuals that were actually ending up in the hospital were vaccinated. So it led people to question, well, what the vaccination is. So in public health, in our meeting, there's something called, I think it's called the Simpsons, I'm gonna say it's the Simpsons paradox. And he just basically put up a grid with dots and then who was vaccinated, who was unvaccinated, who got infected, whatever else. So what the information that what we have been receiving is we have the wrong denominator. So it's a math question. Now, the end result is that it does show, even though there are breakthroughs, that the vaccine, this is a Pfizer data, is 90% effective. What is not debated and is not politicized is what he put on the chart, which is you are 5 times more likely to get COVID if you are not vaccinated. You are 10 times more likely to end up in a hospital if you get COVID and you're unvaccinated. And you're also 10 times more likely to die if you get COVID and are unvaccinated. The 5, 10, and 10 are not disputed. So he asked me, he usually sends me an email before the board meetings when he does the report, hey, what should I include? And so we wanted to include the Simpson thing in. I can tell you it's highly complicated, and I didn't think it was necessary. His report was very lengthy as it was. So I asked him to speak about the efficacy of the 5 to 11-year-olds getting vaccinated and the booster shots. So he included that and much more. But I thought that the Simpsons thing was really highly technical, but it's, the end result is the vaccine is about 90% effective, the Pfizer, so the 2-shot vaccination.
Any new business that you talked about the old business, like Margaret?
Thank you, Mr. Sheridan. I'm not sure whether this would go under committee reports or new business, but I did want to tell the board that the ad hoc committee looking into broadband is getting started.
Okay, that comes next.
Okey doke, I'll wait.
Committee reports right after this.
All right, thank you.
Go ahead, Mr. Forsythe.
A point from the speakers earlier also was a bigger forum. We always went upstairs when there was larger crowds. Is that still possible, or is there issues with that? Because I agree with them, and then they shut the door. And I'm sure that's for noise and whatever, but still, it is a public meeting.
Can I speak to that, Mr. Chair?
Yes, go ahead.
That is an option. However, it's a court setting, so masks would be required at all times when in the chambers. That's something we can explore. Yep.
This is kind of a comment and question. I realize that public input can be valuable.
That is.
It's the Cuba, it's the Havana syndrome again.
Harry was saying.
I think it's the ghost of the courthouse.
It could be.
It's the Havana
The
syndrome.
meeting has been long.
Ghost is bored.
One of the letters that Kelly read seemed to be quite lengthy, and we limit our comments from an individual to 5 minutes. I didn't time it, but it seemed like that went on for maybe 10 minutes.
Me too.
The letters should be limited to 5 minutes too. And I guess my comment would be, I'm not sure what's expected of us as part of our jobs. I'll recognize that while we oversee the Department of Social Services to some degree, particularly the commissioner and the hiring and whoever that is operation, I don't really think it's our purview, under our purview as legislators to review or intervene in cases that are active or decided in family court by the elected St. Lawrence County Family Court judge, which seems like what they're asking us to do.
Mr. Arquette had his hand up as well.
Mr. Hardwood, go ahead.
Mr. Chairman, are we in new business at this point or?
We're still on new business right now.
New business? If I could, unfortunately, make everybody, maybe some people are aware of the unfortunate loss of a great volunteer within the county and over my way. A gentleman by the name of Eric Hondusky, who worked down to the GM plant for a little over a decade. I got to know him a little bit there. He unfortunately suffered a horrific injury to his left, or to one of his hands, having it caught in a furnace, and went through. He was the first, I believe, the first individual in the United States to go through a hand transplant. He didn't let it stop him. He continued to volunteer as both a rescue squad and a volunteer fireman. He was part of the Helena Volunteer Firemen fire group, and I believe he was in the leadership there. But I know it's right across the road from me, and his truck was there constantly. Unfortunately, Saturday early evening, he suffered a motorcycle deer collision on County Route 53 and lost his life. So we've lost a great volunteer in Eric. He was, I believe, right around 55, 56 years old. So if you could keep Eric and his family in your thoughts, I would really greatly appreciate that. Thank you.
Okay, thank you, Tom. Any other new business? Okay, Ms. Haggard, you have a committee report?
I do.
What's next on the agenda? Go ahead.
Okay, thank you very much. As I started to say, the ad hoc committee for broadband is getting started. We've met with Heidi Ames, who is over in the planning office, and she's facilitating for us a group to include Pat Kelly at the IDA, the planning office, David Wolf at DANK, and our own Rick Johnson to all get together and talk about this issue. One thing that did come up was the fact that there may be an advantage to the county making a financial commitment in some form, either through tax incentives or subsidizing providers to be able to get as many people broadband service as possible. I don't know that every person in every area will be able to get it. We all know that. But I know that we're on the precipice of appointing a committee for the use of the ARP money. And I look forward to being able to talk to them about this. But I want everybody to keep in mind that it may require that we have a dog in the fight or skin in the game or whatever they say, because a lot of times with grants, they want to see that we're willing to make a financial commitment as well. And that's all I have so far. I will keep you posted.
Thank you. Yes, Mr. Forsyth.
The RBRDA met Thursday afternoon over here in Canton. All we did was approve the annual budget and talk about a couple tentative projects, one in Messina. They're early stages. And,
Thank you, David. Any other committee reports? Just go ahead, Jim.
The IDA recently met. They have assisted a Messina area chicken raising farm that is expanding its operation to service more of the area's restaurants and wholesale operations. They're beginning talks with some possible tenants for the Newell building, but with the issues on the Canadian border, there's some, it may be a little bit before we see any progress with that. One thing that I want to report to all the legislators, hopefully sometime in the next few months, they will be working with all of your villages and towns and the city of Ogdensburg to hook on your website, to their websites, so that every town and every village, every community in the county has a direct connection into the economic development arm of the county. It's something that has been a priority of mine since I got on the IDA board, and it will allow visitors to your communities and new residents in your community and people who are thinking of moving to your community, when they go to your town or village website, they'll immediately see a button that they can tap to connect to the county IDA and get information on assistance if they want to bring a business, if they want to make an investment in job creation here in St. Lawrence County. So, I hope that as you're talking to your communities and you hear about that you make sure that, they understand that that was a priority of the board to make our economic development efforts better known by being directly in every community in this county. So I just want to make you aware of that, and hopefully that'll be accomplished in the next couple of months.
Thank you, Jim. Okay, any more new business? Or, excuse me, we're on with the reports.
Mr. Terminal. On the screen.
Nicole, go ahead.
Sorry, I just very quickly wanted to ask Mr. Reagan something if I could.
Go ahead, Nicole.
Okay, thank you. Mr. Reagan, do you know if they have plans to highlight the couple of locations that would be considered opportunity zones where there's an additional tax break for people that want to invest in business in those areas? I believe there's 2 in Messina and maybe 3 in Ogdensburg. I believe 1 in Potsdam as well.
I'll find that out and get back to you at the next meeting.
Perfect, thank you.
Mr. Akers.
Mr. Chairman, I forgot under new business, if you would allow me, Mrs. Haggard and I were contacted by Bill Shumway of North Country this week in a request for review of our policy and how we put out a selected newspaper on a yearly or annual, I guess it's the annual basis. North Country This Week now has 6 times the readership as the Watertown Daily Times, because now they have paid subscriptions to their paper, they qualify, that they could actually put in legal notices. So I would request that maybe it's operations next was it services.
Oh, yeah.
Operations. We added them and then we took them off, right?
There are.
But we've never considered them because for legal notices, correct?
No, we do now, yes.
You do?
They are they're our
They're
paper
official.
this year, our official paper this
So
year.
could you send out one the next time they are up? He seemed to indicate he's like 6 years away.
The schedule, yes.
On the schedule.
Yes, and that comes in
Besides Watertown
finance,
Daily
right?
Times
Yeah.
and North Country This Week.
Well, Courier Observer, Ogdensburg Journal, I mean, we can give you the resolution.
They're all Watertown.
They serve different communities.
Essentially, we have two media sources, well, 2 paper sources, North Country This Week and Watertown Daily Enterprise.
We can bring it up at finance.
Yeah, we put it on the agenda for finance.
Thank you.
Legislator Haggard?
Thank you. I was just going to add to that what he said. That I think also Mr. Shumway was questioning about because we go in a rotation between the papers.
Yeah.
He was hoping, because it is very, not to tout a Potsdam thing, but let me just go ahead and do that. It's very well read, and I mean, obviously the online thing is used by a lot of people. If the rotation takes so long for another publication to come up, we don't know how long that will take. Is it 6 years before he's up again after this year?
It would be, I believe, maybe 4 years.
4 years?
4 years, I think.
We can send you a resolution so you can see how.
Okay.
And it's just unfair because all those enterprises, the other 4 papers are all one. They're based out of Watertown.
No more committee reports? All right, let's go on to, do we have a need to go into executive session?
Yes, sir, we do, for litigation and for appointments. And I'm sorry, for negotiations and appointments. I would ask if the board has no objection to have our treasurer stay in for executive session.
No problem. Make a motion to go into executive session? Forsythe makes a move, and seconded by Perkins and Kern, and all.
Hold on, give us a moment. We'll get back online.
Oops.
And Mr. Lightfoot, I'll let you do operations
Sure.
and your services.
Are we ready?
Yep.
Okay. Well, Mr. Chairman, the reappointment to the Environmental Management Council, Catherine Bennett from Hubleton, New York. Do you want me to
Go with services.
vote on that now, or?
No, we'll do them all at the end.
Okay. Under the Services Committee, the following appointments to the Community Services Board: Amy Richardson, Canton, and Anne Marie Snell, Potsdam, both terms expiring 12/31/24. The Community Services ASA Subcommittee, Anne Marie Snell, Potsdam, New York, term expiring 12/31/24. The St. Lawrence County Board of Health, Mark Devers, DeKalb Junction, the term expiring 12/31/27. And the St. Lawrence County Traffic Safety Board, Russ Courier from Governor, Corey Maxner from Waddington, term expires 11/1/24. Reappointment to the St. Lawrence County Traffic Safety Board, Mark Rice, Edwards, New York, term expires 11/1/24. And the Youth Advisory Board, Casey Cannell, Governor, New York, and Joanne Sevick, Winthrop, New York, term expiring 11/1/24. And I move to adopt these appointments and reappointments.
Okay, we want to go finance and then.
Sure, Mr. Chairman, for finance for the St. Lawrence County Workforce Development Board, an appointment of Mary Jean Remington of Canton. And the reappointment to the St. Lawrence County Workforce Development Board, we have Richard Daddario of Messina, Felicia Nair of Canton, Ryan Schimmerhorn of Governor. I move for their appointment.
You're moving all these appointments, correct?
That's correct.
The motion for operations, services, and finance.
That is
Okay,
correct.
That's moved by Mr. Akins, seconded by Mr. Perkins. Any discussion? All in favor?
Aye.
Opposed? Carried. Now, for chairs appointments, the American Rescue Plan Committee, chair will be Kevin Akers, Dan Fay, Jim Reagan, Tony Arkwood. I'll be the ex officio. Motion to adjourn?
So moved.
So moved by Mr. Smithers. All in favor?
Aye.
We're adjourned.
Pick up Nicole. She's already. Everyone had enough.